Great. Good afternoon, good morning, good evening, ladies and gentlemen, depending on which part of the world you are joining us from. And it's a pleasure and glad to host you or welcome you to our day 2 session for our HDC partners meeting. My name's Benjamin Tofa. I come from the KEMRI Wellcome Trust Research Program hosted within KEMRI in Kenya. Just a bit of background, and we had a bit of that yesterday. KEMRI, the Kenya Medical Research Institute, popularly known as KEMRI, is the government parastatal that conducts or mandated to conduct research, and in the process of conducting research also support evidence translation and use of evidence translation and data use for decision making for the Ministry of Health in Kenya. KEMRI operates through research centers, which various faculties called research centers, and I'm based in one of those research centers that is based in the coastal county of Kilifi, Kenya. Our research center has been in existence for about 30 years now, and right from inception has been in partnership with Oxford, collaborative partnership with Oxford University, with co-funding from the Wellcome Trust, forming what is popularly known as the KEMRI Wellcome Trust Research Program. So together with our colleagues from Institute Pastra, we're very glad and happy to act as the host for this year's partners meeting. Now, very quickly back to today's agenda, just and also as a way of background, ladies and gentlemen, for those of you who are very familiar, who would be familiar with the data and health information architecture within the region, will know the role that the WHO Afro Regional Office has been playing in supporting countries, especially in building structures and systems, and also more recently, actually supporting technical aspect of technical support to help the data and information, to support data and information use for decision making within the region. Within that, and you'll be hearing a bit of more of this, I'll not go into the details of that because Serge will be speaking in the next session. WHO Afro region set up the Integrated African Health Observatory, which operates in three broad aims. One is to provide an overall warehouse where all data and health information that's available and verifiable within the region is nested. But within that, also importantly, has deliberately now brought in a network of regional partners and players to support both analytics and translation of that data for regional for decision making at country level, but also at regional level. And this is being done through various aspects of various mechanisms and platforms. One of those platforms, which we had yesterday, my colleague Sheikh from Institute Pastor talked about, is the African Health Observatory Platform for Policies and Systems. This is a platform that is funded or was funded and hosted at the Integrated Health Observatory. It's funded by the Bill and Melinda Gates Foundation, hosted at the Integrated African Health Observatory, and Serge will be speaking more in details about that. That has brought together partners from 5 countries within the region. These are 5 technical partners with skills and capacity to support evidence translation, particularly for policy and systems related questions. And we're doing that through building together or asking questions together with the host countries, and then assembling all the data or accessing all the data and information available within those countries, within the region, and support what we're calling knowledge products or policy relevant knowledge products for guide decision making within the region. This platform has been in existence for the past 2 years and is taking up, it's a bit maturing up now, and we hope to be able to expand it beyond the current 5 member states. I will not go back. As I said, Serge will be speaking more about the first session today, and probably talking more about that platform. So I will not go very much into that platform, but very quickly then go back to who we are and KEMRI and the role which KEMRI has been playing within the region. So my KEMRI Center, as I said, is based in one of the coastal counties of Kilifi, was set up about 30 years ago, and has been mandated to conduct research, or has been conducting research over the past 30 years within what we call the entire breadth and length of health. But we organize our research work around kind of 4 or 5 thematic areas. One is biosciences, which focuses on largely basic biology or what you call lab sciences. The second one is clinical research, and within clinical research, We do a whole range of bedside clinical research and clinical surveillance, including clinical trials. But also we do a lot of health policy and systems research work, and we have a whole thematic area around health policy and systems research work. Linking with that is where actually we host all our activities that focus on evidence translation and supporting decision makers, policy engagement, evidence translation, and supporting decision makers for data use for decision making. And last but not least is a whole program of work or thematic area around epidemiology and population health, which focuses on doing both local level but also large scale epidemiology and surveillance work around a whole range of issues. And we do use this data to support decision making, but also use it as a platform for supporting and strengthening some of the routine data processes that the Ministry of Health in Kenya and also across the region is doing. Just to speak to two very specific examples of those surveillance platforms. One is a demographic and health surveillance system, which is integrated that we've set up in Kilifi County, where we are based, and it's been running for the past 20 years. In this demographic and health surveillance system, what we do is we actually do population level data capture for death and births, a whole range of population changes, including verbal autopsies. And that is actually linked to clinical surveillance within the entire county and linked to the laboratory surveillance. We do use this platform, of course, as a sampling frame for a lot of our studies. But as mentioned, we also use that platform to support decision-making in terms of validating some of the routine activities that are happening, especially in terms of vital statistic monitoring, but also actually for monitoring health interventions within Kilifi County. The other surveillance platform that we also want to mention before I conclude this session is a clinical network or clinical surveillance system. So we've set up also across the country, that's beyond Kilifi actually, in 14 out of the 47 counties, county hospitals, we've set up an integrated clinical surveillance within which we actually monitoring real-time clinical events in those hospitals. I've been doing that for the past 13 years in partnership with the various counties and Ministry of Health. We've been using this platform quite a lot now to support actually real-time quality of care, expecting an improvement in those hospitals. More importantly, actually, in the past few months, especially in the context of the ongoing pandemic, we managed actually to be able to track events that are happening in the hospital that can be related to the pandemic. I just wanted to flag off those two specific surveillance things because they speak very much to some of the conversation that we had yesterday in terms of the thematic areas or the kind of best case example which were being shared by the various countries yesterday. I'd be happy to talk about this more, again, time allowing within the plenary. We have a quite a rich agenda today, and I'm hoping yesterday we had a very good and active participation. I'm really looking forward to very active participation. We have a very quite rich menu organized around 3 broad sessions. So before we go into the actual sessions for today, which I'll be introducing one after the other, I want to take this opportunity first to introduce and invite Craig. Craig is a development cooperative specialist from WHO and also a key and player and member of the HDC, who are also acting as the secretariat for this event. And I'm inviting him to take us through just a brief recap of the events of yesterday before we go into the sessions today. Welcome, Craig.
Thank you, Benjamin, and echo your warm welcome to everyone. And bearing in mind, this is everyone's collaborative, so it's a joint ownership. What I'd like to do, Benjamin, is really give some highlights from yesterday and also give an overview of today and what we hope to achieve today on behalf of the HDC Secretariat, which currently is myself, my colleague Mwenya, my colleague Alex as well. So briefly, yesterday we were very excited that these 2 days are co-hosted by regional institutes. So the Institut Pasteur Senegal hosted yesterday. We heard from Sheikh on the Institute's overview and vision and some of their work. We also heard some reflections from our co-chairs, the HDC co-chairs, Helen from the Ministry of Health in Kenya and Jennifer from UNICEF as well. And then the first session was really demonstrating good country practices. And this really fulfills the first objective of this meeting. It's to really to share country good data practices across different regions as well. And we heard from our colleagues in Kenya, colleagues in Botswana, colleagues in Malawi, Cameroon, and Burkina Faso, sharing some technical good practices on CRVS, community data leaving no one behind, digital health and interoperability, some data and digital governance, and some routine health information systems. So really some good practices being demonstrated by country leadership that we hope, and this came out one of the sessions, could be either exchanged or capitalized on and built on really. And then we heard from our colleague Diane on some country good practices in the COVID era. And then session 2 was much more about working groups. And we heard from many of the working groups, including CRVS, routine health, data, digital governance, and community data, giving some of their very good perspectives on what work they're doing, they have done, what they have planned for the next year or two, and what things they possibly need to change as well moving forward. We also heard some closing remarks yesterday from Dr. Samira Asma, the ADG at WHO, really helping to guide us in terms of her vision and what WHO's vision is just now for data more generally. So it brings me today, colleagues, and as Benjamin has highlighted, thank you to the KEMRI Wellcome Trust in Kenya for hosting this. And we've got 3 main sessions today. The first one is facilitated by our colleague Patricia, who's the representative from the private sector constituency. And in that, session 3, we'll have an overview of some of the environmental factors and the contextual factors that may influence HDC and SDG gap data and digital efforts in the coming couple of years. So we'll have a series of presentations there and then your feedback. The next session is really making the case for an investment case in health information systems. We will hear the sessions facilitated by Nicola from the UK and Ernesto from Germany, making the case from Shada and Johannes on investing in country health systems and what may need to happen in the next year to do so. And the final session is really giving you an overview of the health at the HDC status and the possible milestones for the coming 2 years. And that session is facilitated by Heidi from Gavi and Nida from Save the Children, representing the civil society constituency. I'm also joined in that session by 2 UNICEF consultants, Nadej and Serena, who've been doing some interesting work on alignment in 2 different regions as well. Then later on in the day, we'll hear back from KEMRI and Institute Benjamin and Sheikh, Institute Pasteur, to reflect a bit more on what roles the regional institutes can play for alignment and supporting countries in the HDC. And then lastly, we'll hear from strategic priorities from Jennifer in UNICEF and Helen in Kenya Ministry of Health, and some closing reflections from Mark Herward, who's the Associate Director in UNICEF as well. So with that, thank you very much for everyone attending. A couple of quick announcements. If you need to ask questions, please put them in the chat for Q&A so the facilitators during the day can capture them. And everyone should have access to the Google Drive, which is in your chat there, which contains all the background documents and all the presentations as well for the 2 days. So with that, again, a warm welcome and thank you to everyone for joining, and back over to you, Benjamin. Thank you.
Thank you so much, Craig, for that nice recap on and reflection on the activities of yesterday, and also a quick overview of what to expect today. And I really hope you've managed to whet the appetite of our audience this morning. So without wasting much time, I want us to dive straight into our first session for today. And to facilitate that session, as was highlighted by Craig, will be Patricia Monthe, who is the head of operations from MEDEX. Over to you, Patricia.
Mute. Oops. Better? I think it's good now. So thank you, Dr. Benjamin, and hello, everybody. Hope now you're listening and hearing me. So I hope you're enjoying this event, started yesterday. I'm Patricia Monte, have the luxury to be part of this amazing group that is doing a lot of work in moving everything around healthcare and data. In the group, I'm the private sector representative. Why private sector? Because I currently run a company, like already mentioned by Dr. Benjamin, but we're not going to go too much into the private sector now. Yesterday, you had the luxury to hear and listen, on the ground story from the different governments, amazing transformation taking place in different parts. What I believe we're going to go into, and I feel we're going to go into during this session to Richard, it's what I call the internal affairs of the HDC, and let's call it as well the strategic objectives of the coming year. So having said that, the first stop will be Richard, and over to you, Richard. I'll be back, and I hope you enjoy the different presentation that will be given to you now, and we're going to get into conversation later on. Thank you. Over to you, Richard.
Thank you, Patricia, and thank you, everyone. So I'm from UHC 2030, and first thing to say is happy belated UHC Day to everyone. Sunday was Universal Health Coverage Day, so the international day for acknowledging and marking universal health coverage. And UHC 2030 is the global partnership for stronger health systems for universal health coverage. And as Patricia and Craig have said, this session is about introducing some of those other partnerships and some of those key moments contextually that the HDC is operating in. So I'm going to tell you a little bit about a couple of our products and moments that might matter for the HDC. And one aspect of our work is to convene a network of networks who all care about different aspects of strengthening health systems, one of which is the Health Data Collaborative. And to introduce that network, we're going to kick off with a video. So I'll hand over to that, and that will give an overview of what are some of the health system priorities that we care about as UHC 2030 and the broader universal health coverage movement, and where do some of the networks, such as the Health Data Collaborative, fit into that. Over to the video, please.
How can we ensure everyone gets the health services they need and is protected from pandemics? More than 5 million lives have been lost to COVID-19. Health services across the world have been massively disrupted. Health workers have been put at risk, and vulnerable people and communities have been left behind. To address this, we must ensure universal health coverage so that everyone, everywhere, has access to quality and affordable health services. And we need action on health security so that all of us are protected from further disease outbreaks. These two goals are linked. We know that building resilient and equitable health systems is the best and most sustainable solution. Doing so will ensure that communities everywhere have health workers nearby and services and medicines that meet their needs. UHC 2030 and a group of alliances and networks are promoting learning and successful approaches to help countries achieve these goals. They bring together diverse groups, including countries, international organizations, civil society, philanthropies, and the private sector. What are some of the health system's priorities? And how do these partnerships contribute? Primary healthcare will ensure that people and communities have access to health services that meet their needs. The Primary Healthcare Performance Initiative. The UHC Partnership. We must support and protect health workers so they can protect us all. The Global Health Workforce Network. We need to ensure health governance that empowers people and communities. The Health Systems Governance Collaborative. Health financing must be efficient and equitable. Providing for health. We need good quality data and health information systems to support decision-making. The Health Data Collaborative. And we need to share learning, evidence, and research on how to strengthen health systems. The Joint Learning Network. Health Systems Global. The Alliance for Health Policy and Systems Research. These networks are coming together to support progress towards universal health coverage. Now, more than ever, let's all work towards stronger health systems and leave no one's health behind.
Great, so that video is there to remind us of the goals that we're all working towards in terms of universal health coverage and health security, the means that we're taking to achieve those goals, which is strengthening health systems, building more resilient and equitable health systems, and then again to remind us that the Health Data Collaborative is really important as one of a whole series of networks and partnerships that are contributing to strengthening health systems. And then to come on from that, where does UHC 2030 fit in? So UHC 2030 is as I mentioned, is the global partnership, multi-stakeholder partnership for stronger health systems for universal health coverage. What we're trying to do to contribute to those UHC goals is really focus on bringing partners together around political commitment for UHC and collective action for UHC. So that means that our work focuses a lot on convening. It focuses on ways to improve collaboration and alignment. It focuses on ways of bringing people together for political commitments, such as we saw at the UN high-level meeting on UHC in 2019, and we're going to see again in 2023 at the UN high-level meeting on UHC. In terms of what UHC 2030 looks like, we've got a secretariat that is co-hosted by the World Bank, WHO, and OECD. We've got over 90 countries who are signed up as members, a whole host of UN and international organizations, philanthropic foundations, a really active civil society movement with over 1,000 members in our civil society engagement mechanism. We have a private sector constituency. We have a coalition of partnerships, which brings together a lot of the different disease-focused groupings to think about shared UHC and health systems goals. And then we have the related initiatives, which you've just seen the video on, and that's where the HDC fits in. So I think you probably get a sense from that. There's a lot of overlap in membership with the HDC, a lot going on. Next slide, please. What I wanted to use this presentation to is just to highlight a couple of products that we've had recently that might be of interest and that link in and complement some of what the HDC is doing. The first is something called the State of UHC Commitment. And since the high-level meeting on UHC and the political declaration that made in 2019 in New York, we have each year done a review of our countries really moving on their political commitments for UHC. Now, this really complements the more technical global monitoring reports that you're probably familiar with that look at service coverage and financial protection and bring together the data on that the World Bank and WHO publish every 2 years. So you'll have seen a couple of days ago, UHC Day, that global monitoring report with the data on UHC came out. We also had our State of Commitment review came out to complement it. And the main finding was that countries have made a lot of commitments. There's a lot of countries prioritizing equity, but we're really seeing gaps between those commitments and implementation. And we're seeing that really heightened by the additional challenges that COVID's brought along. So I think one of the things that would be interesting to reflect on is to address some of those gaps, what can the HDC be doing, both in terms of accountability and in terms of the strengthening data systems that we know are so important as part of strengthening health systems. Next slide, please. And then another product that I wanted to highlight is a new paper that we put out very recently, which is meant to provide a shared narrative for strengthening health systems. So really, it's a really big high level. How can we come together, put health systems back on the agenda in the context of COVID-19 and help guide and shape what the global advocacy and action is that's needed? So this isn't meant to be a technical paper. It is much more a political and advocacy narrative, but it signposts to some of the technical recommendations. And so UHC 2030 as a movement is coming together behind its role as to how to promote political leadership for stronger health systems for UHC, how we can mobilize better aligned resources, so how we can make sure there's both more money for health systems and that this is taking a health systems approach and is actually aligned to government's needs and requirements and plans, and how collectively we can demand and act for solidarity and equity. And this is, of course, really, really important in the context of vaccine equity, but also seeing how the crisis shows us the need for equity more broadly and solidarity and how we all come together and help countries in terms of strengthening health systems. And we think this narrative, all of our membership has come up, our steering committee has signed up and said, yes, we're going to walk the talk on this. It will inform priorities for the UN high-level meeting, which is going to come up in September 2023. So one of the things that we're there to do is help guide that process in terms of multi-stakeholder engagement and bring together some of the different partners so that they can feed into the formal UN process for that high-level meeting. So I'd really encourage you all to look at this paper. And what would be great to think of in this discussion now that will follow is what is it that we collectively need to renew a focus on strengthening health systems and how the health data collaborative partners can help contribute to that, how we can all make sure we're talking the same talk in terms of what's needed and in terms of alignment. And then, yeah, bridging from that, from talking the talk to as the health data collaborative is doing, you really are walking the walk on this in terms of what it means to really align behind different aspects of strengthening systems, how you're, as I know you're discussing, how you align behind strengthening data systems, and then plug that into the broader effort of a joined-up approach for helping countries to strengthen our health systems, both for UHC and for health security. So with that, I'll hand over to Rachel Snow from UNFPA, who will talk about the SDG3 gap.
Good afternoon, everyone, and I'm delighted to be here with you. Again, my name is Rachel Snow, and I'm here with you from UNFPA. And indeed, I think it's helpful, this discussion of a network of networks, because I think a lot of what we're going to hear about in this session from several of us are some of the interlinked kind of platforms through which we're trying to accelerate work very much together in a shared effort here. If I may have the next slide. Now, there's another anniversary and celebration today, and that is that this is the 2-year anniversary of the launch of the SDG3 gap. And that was initiated, as you see, in 2019 here at the UN General Assembly. But let me note that on the right-hand side, while the initial mission of the SDG3 gap was very much to unify the collaborative effort across that SDG3. The mission is a little different now, and of course that's due to COVID. And so you see this greater effort right now to make sure that the work of this gap, global action plan, is very much focused on the building back better and recognizing that there were a lot of weaknesses exposed in the context of COVID. Please, next slide. Let me draw your attention to the left-hand side of the page first. And I think these 4 commitments are really important about the way that the gap is working. And the first, of course, is to engage. And that means to work very, very closely and directly with countries to advance their priorities collectively. To accelerate not only the work of the various themes I'll tell you about in a moment, but also there's this underlying commitment to gender equality, which is a kind of cross-cutting theme that moves all over the work of the gap. And I want to emphasize that. In terms of alignment, this is really about harmonizing not just operational strategies, but policies and approaches, and even financing as the situation allows. And then last, under account, it's really to share accountability, to make sure that there's that close review and look back at what's working and what's not working. In the middle panel, this is a whole list of the different accelerators. There are several, indeed. And I'm going to speak to you most pointedly about the data and the digital accelerator. But I also want to highlight that this accelerator works very, very closely with the one on primary healthcare, PHC. Okay, next slide, please. So really thinking about the added value of this accelerator, the first point that's there, the first bullet point is super important. It's one of the reasons that we're presenting here today is because there's this new alignment that's been undertaken in the context of 2021 to really join the Health Data Collaborative with this accelerator, which is on data and digital. Why? A lot of you are the same individuals who are in fact engaged in both of these processes. And so really making sure that there's some efficiency across our efforts is hugely important. But it also simplifies and streamlines the points of entry for our collaborating partners across the world, including the governments with which we are working extremely closely. This gap is, this accelerator is very much focused on three countries for in-depth work. That's Malawi, Nepal, and Pakistan. And part of that is about kind of going deep with multiple tools and being able to see what's working, what works together well, and then being able to take that to scale. Okay, I'll go to the next slide, please. In the context of 2021, indeed, we were reviewing a lot of the different tools we're working with, and we decided, in fact, to focus on really two big focal areas, in addition to this concentration on pilot countries. And the two big areas were GIS for health, and then to scale SCORE. Let me go to the next slide. Why are we talking about GIS? And please just click forward so that the full slide is displayed. Yeah, thanks very much. Well, first, let me say that for both UNFPA and for WHO, both of our institutions who are co-hosting this accelerator have really made big investments in geospatial data and analysis over the last couple of years, and we want to capitalize on that. But let me put my UNFPA hat on for a moment. We work a great deal in census across the world. And I really just want to underscore that this census round, which goes from 2015 to 2024, is going to be really transformational for all of us. And that's because so many countries across the world are geo-referencing their census. And what that means is we have a degree of locality on population data that's never existed in the world before. And what that enables, and here's an example from Malawi, is the mapping of the health facilities, looking at catchment areas, but then being able to put, in this case, the very latest 2018 census data over that map and be able to look at, again, well, how many people are within whatever you want to set. You want to set 2 hours of transit, you want to set 20 kilometers, you want to set more than that. So being able to much more effectively work with governments to use their data, their population, latest data, and health sector data to optimize the distribution of services and facilities. And that's already brought lots of efficiencies in countries where we're working, sometimes even reducing the number of facilities, but actually expanding coverage because it's responsive to the very latest population data in country. Next slide, please. Now, SCORE, as you know, SCORE is sort of 5 big commitments under the letters of SCORE. It's to survey, to count, to optimize, to review and enable. And the first 3 of those letters are really about expanding the quality of the data available in the health sector. And the last 2 are about using it and distributing it. And within that, there is very much under the count, this emphasis on civil registration. And this is a slide from 2019. And I wish I could say that it's vastly improved, but our evidence is that some of these data are not so much improved. So I think there are some regions that are doing a little better than 2019. But I think overall, I think what we saw in COVID is really how serious it is that we don't have death registration data, we don't have cause of death data, and that has so much hindered the ability to track what's going on in the epidemic. But of course, indeed, this will extend to birth registration as well. Last slide, please. And so just thinking about what we're planning to do in 2022, first of all, we're going to really be resetting alignments with the 3 core countries where we're working. And that applies to the geospatial as well as the SCORE work. But just to sort of zone in on some of the civil registration activities intended, we'll very much work with the ministerial conferences and priorities. And this is about expanding coverage not only in the health sector, but also in communities. So this movement towards the digitization of CRVS is not only for within health facilities, but very much for communities themselves. And that is a very clear priority for governments. And then we hope, of course, to take those lessons to a much greater number of countries. I think the last slide is just to say thank you and provide for you the link if you'd like to look more deeply. And it's my pleasure now to hand over to Lawrence Mumbai, who is here with us from the Global Financing Facility. Please, over to you, Lawrence.
Thank you very much, Rachel, and good morning to a number of you, and good afternoon as well. And thanks to some, it's good evening. Building on to what Rachel has said, a lot of what I'm going to be presenting actually draws lots of complementarity from the earlier presentation. And this is about the alignment working group, and just a bit of background onto what the alignment group is about. If you could go to the next slide. So the alignment group is a collaboration between some of the partner countries within the GFF and the donors. So it was mandated following a discussion about the need to renew a lot of the efforts that have been ongoing around the work on alignment and aid effectiveness. So it's grounded in the basic tenets of we needed, in order for us to have efficiencies and effectiveness in how we work, we need to have one plan, we need to have one budget and one report. And the goal is to maximize the effectiveness of which health spending is, or the effectiveness of health spending in order to improve the outcomes. So the aim is, one, developing and delivering guidance on policy recommendations, and that is in a country-led process, a bottom-up approach. And then the second one, the group is also focusing on operationalizing some short and medium-term activities, working together with the countries to ensure that some of the issues that they identify are actually, they have some sort of support to implement them. Next slide. The membership of this, we have, like I said, it's led by the ministers of health, and I've listed the number of countries currently that are involved. But in addition to that, we have from the UN constituency, the WHO is representing them. From some of the Global Health Fund constituencies, we have Gavi, and so bilateral agencies, the FCDO and USAID, and then the Bill and Melinda Gates Foundation representing the foundations. On the next slide, we talk about some of the technical challenges, and if you could just continue on to the next graphic. This just breaks down the one plan, one budget, and one report, and also looks at some of the key challenges that may be that have been continuously identified, including, for example, the inefficiencies such as poor prioritization, fragmentation, and duplication that have been identified as some of the challenges that as to why there's multiplication of plans. Then the issues about, and we've talked about, is financing, the decreasing public support, also the reprogramming of existing financing to answer to COVID needs, which in essential leaves a lot of challenges around the essential health services, which technically need to continue as well. And the areas around how do we ensure that the government, donor, the private sector, and civil society have a platform that is bringing everyone together and addressing some of these challenges. So those are some of the technical challenges that we identified as to why we are having slow progress in some of the initiatives on alignment. But over and above that, there are some other adaptive challenges. And if we go to the next slide, we'll talk about, we approach them as some of our, next slide, please. Thank you. We bundled them up as what we call the political economy of alignment. And some of these issues go beyond just the technical components. They have areas like understanding the peculiarity of some of the partnerships that are happening on country, understanding some of the key challenges as to why, in as much as we say we need one plan, some donors, some governments may never. It becomes almost impossible legally for them to actually do that. And by knowing these challenges, the question then we're starting to ask ourselves is, how can we come up with mechanisms of working within these issues, as we have mentioned? Some of the key other issues that come up was, well, because we have not had comprehensive bottom-up tools to assess this, a lot of them are very technical in their approach. Then it was required that we actually approach this from a slightly different angle. So if we could go to the next slide, it shows the objective. Given all that, the alignment working group was set up to advance the alignment agenda at the country level and give voice to some partner countries in the discussion around how external and domestic financiers can better align their support. And it works on three main principles. That is, one, the group is led, it's the country leadership. The aim is your alignment around a given set of results, and then whatever which is being done needs to be evidence-driven. The key activities was, one, to start by understanding the political economy, why some initiatives have had success and others have had a lot of challenges. Then the second one was to develop a maturity model that would track, given that we need to ensure that we contextualize how far each and every country has gone. We needed to know a maturity model that was clear in terms of the basic to the highest level, and in between that, such that we should be able to track the progress of alignment across a continuum. And in order to do that, that maturity model was to be informed by a diagnostic tool, or what we call the health check. So on the next slide, we have a theory of change, and it draws out a couple of barriers that is both technical. Yes, and it draws out both between the technical and the adaptive challenges. We have a couple of inputs there. If we just go back to the slide a bit, and in the inputs, we have a key about around three areas. Number one is investing in country systems through technical assistance, using existing resources that we've talked about here, such as the UHC 2030, and then enhancing global initiatives, of which the alignment working group was one of them. The other is some of the adaptive shifts that are required, and that is issues around behavior change in terms of ensuring that we move beyond just commitment to actually implementing some of the commitments we've made. Then a couple of behavior changes around from the donor side as well as the countries. And this will involve us ensuring that rather than saying that country systems are inherently weak and as such cannot be used, there is a concerted effort to strengthen these systems in order to make sure that they are fit for purpose. And the activities are then going to be, they're bunched up into broad buckets, but the key items under those are to be determined by each country, depending on what the health check showed. And then we have output, but the end is to contribute toward the UHC as per what the meeting is talking about, as for what our discussion today is about. So On the next slide, we really it tries to reemphasize how the setup is and what the central role of the country is. And as part of this working group, especially at the country level, we have the ministers of health designated as the key principals. And in most of the countries, the 8 countries that we mentioned earlier, the director generals of health have been designated as the technical alternates. And these principles also form part of the global working oversight group, including representation from the different constituencies that I had mentioned earlier. And specifically at the country levels, they have been tasked with creating a working group that will ensure that there's buy-in from all the stakeholders. And in addition to that, they're supposed to implement the diagnostic exercise or the health check, and then map how far the country is towards the alignment based on the maturity model continuum. In addition to that, there's participation in some of the strategic leadership programs that the Global Financing Facility will be running. And these are aimed at not really the technical component, but addressing some of the adaptive and behavioral issues that may arise in order to facilitate stakeholder engagement and discussions within the country. Next slide. So I will summarize the presentation by showing the implementation approach. For the start is at the beginning, once the working group is set up at the country, we'll ask them to do what we're calling a health check. And it is intended as a preliminary process to be conducted by the government and its development partners to understand how far is there other efforts of alignment, what are some of the key challenges, and what are they going to be doing about that. And after that, after doing that health check, given how they score themselves, because this is like a 360-degree participatory approach, they then can track themselves on the maturity model, which is a continuum that has 5 steps, with level 1 being the basic and level 5 being where we have achieved the 1 plan, 1 budget, and 1 report. Now they would have to sit and agree on where exactly they are on the continuum, and then in addition to that, come up with a set of activities on how they're going to continuously improve, including an agreed upon timeline of when they're coming back to review the progress. I've noted that some of the key enablers for us to achieve this would be 1, having clarity on ownership of the tool, both at the global and the country level. And we are putting a lot of emphasis on the bottom-up approach where the country leads this, and then that information, those experiences that are drawn from the country level are then passed on to the global level to inform how we can better develop global initiatives that are aligned to what that are responsive to country experiences. The other one is also that came out from the political economy analysis that there needs to be strong political will. Again, it brings us back to ensuring that the country leadership is at the center of this. The bottom-up approach is going to be the best way we can actually assess the political will. But the last one is the part where almost everyone comes in, and that is the operational capacity at the country level. I'll then stop here and I'll say thank you very much for this. And I'm going to hand this over to Gwen Diane to give us a presentation on the Decide Hub. Thank you. Over to you, Gwen.
Thanks so very much. Hello, everyone. Thanks for giving me 5 minutes, and I'll try to stick to 5 minutes to present Decide, which is sort of the latest kid on the block. I think that second slide, it was supposed to be a pun because the first slide was actually a series of block, and it was, it tied up with the idea that we were the latest kid on the block, but that's all right. So Decide is the health decision hub. It's not a network. It's an open collaborative space based at WHO, which stems from a request back in the end of 2019 of the health economics and the HTA communities, plural, who were saying, we're working on cost effectiveness analysis, we're working on value for money, we're working on HTA institutionalization, but we don't necessarily work well together in terms of alignment of our methods, tools, and country action. So could we have something? Could we have a space where a sort of safe space where we can co-produce knowledge, share insights, but also develop products together with countries? And we at WHO, I'm based in Richard Gregory's department, Health Systems Governance and Financing. So yes, why don't we do that? And then that's how, supported originally financially by the Bill and Melinda Gates Foundation and WHO, we set up the Decide Health Decision Hub. So as you can see, we've got 8 board members now. We've got the Africa Center for Evidence, which is not necessarily a health stakeholder. They invest a lot on real-world evidence for better policies across the policy spectrum. We've got the Council of Europe Development Bank, who's the main investor in social infrastructure across the European space. We've got the European Society for Medical Oncology, which, despite the European, is actually helping across the world developing cancer services. INATA, you probably know the International Network of Agency for HTA. HOPE, which is the European Federation of Healthcare and Hospitals. And SHELD, obviously there's WHO and Bill and Melinda Gates Foundation. SHELD is the Center for Health Ethics, Law and Development, based in Nigeria, but working across the region. Those are the board members of a hub, which is the Global Hub for Value for Money. So our mission statement is really to support evidence-based decision in health and try to help decision makers through data, analytics, and knowledge. So that's one first point of convergence with HDC, which is our sister network, if you want. Our remit will span priority setting, HTA, benefit package, capital investment in health, contracting models, predictive modeling, and health transformation, marrying all these different parts to ensure value for money across the policies and program. We rely on these members, and that's why I took some time to present them, because as you can see, we can tap into the expertise of these members when we work on capital investment in health. We naturally turn to HOPE and the CEB. We turn to ESMO when we develop capital investment in health tools to manage infrastructure, which are refurbished for oncology services, for instance. We work a lot with INATA and ESMO on high price, I call them high price drugs, and they always told me, no, Gwen, it's high cost medicines, things like that. So that's the primary network we have. But of course, we've got on our digital platform around 1,500, a little bit more, individual experts coming from different institutions across the world and helping us co-produce our products. So that's what we do. We decided to digitalize our way of operating. And I want to emphasize that we decided that before COVID-19, even though the Decide Hub has been in operation for 2 years now. We started 1st of January 2020, best of times to start an international network. And so everyone is coming on the digital platform because it's where we manage our project. We develop operational solutions for decision makers. That's our core business. Everything we do is about designing practical tools, enshrining countries at the design stage. So we do have countries participating in the design of our tools so that we make sure they're relevant, they address the needs, they address their capacities. We also host communities. We're very proud of, for instance, the WHO Fair Pricing Forum has officially decided to join Decide, and we host them on our web platform. We host Capacity, which is the country-led tool for immunization, and we host the CMCC, which is the COVID modeling consortium. So across these communities, we started being really in a good position to exchange insights, but also nurture sort of a greenhouse of ideas of what should we work on together. So example of our products and work streams, we will put next month, January, the CDAS online, the cost effectiveness data across setting working group, which has been active across 2021. So it's the gathering of 20 institutions from IHME, WHO, the World Bank, We had prominent universities working on cost effectiveness, how to help decision makers navigate methods, tools, data sets, what data set to harness and fetch in order to make decisions that are cost effective. So we created a digital tool, which is a support for decision makers to help them, according to their settings, deciding where to go for national data. In the absence of national data, what sort of estimates are available, what sort of cost effectiveness method you use, etc., etc. So we've got a consensus around that sort of tool, and it's going to be available next month on the web platform. Same with capital investment in health. We are offering the possibility to sweat the asset, whether you've got an infrastructure project, whether you want to invest your capital in building, refurbishing, reallocating part of the activity of health infrastructure. We build that with countries. CDAS was built with Ethiopia, with Ghana, Pakistan, part of the design team. Here we have the UAE, we have Côte d'Ivoire, we have another set of countries. One area of particular interest with HDC is Bolster. Bolster is a video game for policymakers. It's the what if scenario generator, which allows you to factor in not only the health data you need, but also across, my colleague from GFF mentioned the political economy. Obviously, we all know that external drivers will drive health efficiency much more than the health sector itself. So you have a plan for health system transformation. Have you accounted for social protection, transportation, labor policies, etc., etc.? So that's what we are developing. We are at an early stage where we are building the analytical platform, and we will need to train analysts to harvest and fetch data. So that's where we really want to collaborate with HDC. We're doing the same for an HTA pathway, how to institutionalize HTA, how to HTA, and at WHO we produced a guide which is a practical guide to help countries. So we'll use that resource, but a lot of other resources, and that group is chaired by INATA. High cost medicine is a shared group which will produce practical recommendations for negotiation, prices of drugs, cancer drugs, and it's going to be ESMO, the Fair Pricing Forum, INATA. So we're going to have the state-of-the-art recommendation of practitioners, etc., etc. So I'm not going to go through all our products. Something you might be interested in is the Bergen Conference in April 2022, the International Conference on Priority Setting in Health. We co-organize that, and the deadline for submission of abstract is 15th of January. So if you're interested in priority setting, if you think you can contribute something that you would like to share, please don't hesitate to go on their website. Next slide, please. Thanks very much. So Moenia and Craig told me you need to talk only about how can we collaborate together and where to start. You are the HDC, so any product, data-intensive, evidence-based product that you develop is of interest. Can we help? Can we benefit from it? Your capacity to train and sensitize leaders and decision makers in the value of anticipation of forecasting the outcomes and impact of health policies is of interest. You are just like us, a health system-wide. You span the whole spectrum of health systems. So we're not necessarily developmentalists per se. We're not necessarily focusing on one aspect of health system strengthening. So that's where we need to collaborate. Digitization is obviously something we're quite strong on, and we follow the lead of HDC there. And then perhaps one area where we would like to engage with everyone on board actually is that we do not have a country presence. We've been set up as a technical hub in order to create products with decision makers so that helps them take evidence-based decisions to secure value for money. That's our mandate. But in terms of country impact, you all have a role to play. If you're interested in conceptualizing, developing, rolling out those tools, bringing new ideas and tools, and then having the possibility to implement them at country level, then please feel free to contact Decide. The last slide is just our email address or our platform. No, we can skip this one, don't worry. It's just we have blogs, we have news. Please feel free to add your news on the platforms. It's very open. And you can check us out at decidehealth.world. Thanks very much. I think it's time now for my dear colleague from WHO Afro, Serge Pataliak, who's Strategic Health Information Officer. And if you have any questions, you've got my contact details. Thanks very much.
Thank you, Gwen. Thank you for your presentation. So I would like in the next couple of minutes present you the Integrated African Health Observatory. Next slide, please. So the Integrated African Health Observatory is a direct response to a need. I mean, in 2009, the Minister of Health in the region asked WHO to set up an observatory because of a certain of reasons. One of them is the fragmentation. Some of these issues are still in our region and even in the world. But the idea was to set up a single platform that will allow everyone to access reliable health information in the region. 10 years after, a lot of things have evolved. Many things have changed positively. And in the region, after setting up the African Health Observatory, the next request was to support setting up National Health Observatory. I think in all the 6 regions, Afro is the only one where we have also National Health Observatory managed at the level of the country. The idea of the observatory is to have a platform that will strengthen availability and use of information, also support monitoring and evaluation of different intervention and program in the region and within the countries. Next, please. So the aim is simple. A platform that integrates health information under a single regional platform. So within one platform, you have access to the Regional Health Observatory, but also for WHO African region to the 47 National Health Observatory. That's been each National Health Observatory for each member state. The idea is to have a single source of anything health and health related in the countries of the WHO African region. So you have the link to the platform that hosts several other platforms. So during the next slide, we'll get more detail on that. Next, please. Next. So IHO the idea is to have a one-stop shop for health information in the region. We know in different countries, there are a lot of systems, normal routine health information system. Most of countries are using GHS2 for major programs, TB, HIV, AP, maternal, child health, IDSR, malaria, and so on. There are also other systems. Next, please. Human resource, insurance, logistic, finance. So all those systems, the idea is to feed with standardized health information, standardized analytics, standardized knowledge product, a regional repository with information coming from surveys, CFRS, using some exchange platform, API, and so on, to have a regional standardized repository where everyone can access through a front end some of the published reports, survey data, annual plan, and the user can come from Ministry of Health, planners, facilities, donors, and partners. So it's really a joint action, not only at the regional level, but really coming from down. It's really coming from countries that are in charge of pulling out all this information on the platform so that everyone, all the validated, because the idea is really that the country are sharing all the validated health information so that everyone can access it. So that's the focus, the primary idea, I mean, the focus of the observatory, the Integrated African Health Observatory. But we do host also several platforms. Next, please. And one of these platforms was highlighted by Benjamin the moderator of the day. And one of these platforms is the platform on health system and policies, which is really a good example of multi-country partnership. The aim of the Integrated Health Observatory is really to focus on data, analytics, and knowledge. But by setting up a specific platform on health system and policies that is hosted by the Integrated African Health Observatory, the idea is really to strengthen the knowledge component of the Integrated African Health Observatory. So we are working on this platform with partners, of course, WHO Afro region, London School of Economics, European Observatory, and the donor for this first phase is Bill and Melinda Gates Foundation. The idea is to generate a lot of knowledge product around health system and policies. So we have identified 4 key outputs. The first one that we have started already is the country health system and service profile. The second one is to develop key policy brief that really inform the different countries. We are also working on comparative studies and also setting up policy dialogue. Presently, we are working in 5 countries, and the 2 co-hosts of this HDC partner meetings. Our members are as national centers, I mean the Kemri Wellcomes Trust and the Institut Pasteur of Dakar. We are also working in institutions in Rwanda, in Nigeria, and Ethiopia. So the idea is really to use the capacity, the different advantages bring by different partners to strengthen and all the national center experience, to strengthen the generation and use of knowledge within the region. We are starting with this phase 1 with just 5 countries, but the idea is really to expand. And within the context of the HDC, this is really an example of a multi-country partnership that brings together a lot of partners with different backgrounds to support the use of the generation and the use of knowledge. Next, please. Next. So within the region, the process of setting up, of supporting the implementation of National Health Observatory has really evolved. Now we have over 35 countries in the region that are engaged in setting up their National Health Observatory. And for us, it's really the base. The same way we think that the IHO should be the one-stop shop for health information in the region, National Health Observatory should be the place to be in all the countries. And I know in some countries, the HDC is working really hand in hand with National Health Observatory to bring together a lot of partners, because among the function of an observatory, the function of bringing together people, exchanging with collaboration is key to have access to a lot of that information that can be shared. So AFRA is providing strategic and tailor-made support to each country because the contexts are different. There are countries where you have really many stakeholders engaged. The idea is not duplicating, but the idea is to use the advantage that each partner can bring to set up a global platform in the countries that can support and make sure people can access health information available publicly. Next, please. So this is the areas on which we are working. We are working with a lot of partners. One of the areas is about advocacy. You know, the issues about sharing, the issue about using data, the issue about generating data. So sometimes it has to do with a lot of advocacy. There's also the support around capacity building. Sometimes using data can be something we think at our level straightforward, and even analysis. So we are providing with partners capacity building to countries in that area. The question around technical support. Now there is a lot of tools available. We have a lot of tools, and all these tools are very interesting, but we need to have tools that really address the need of each country. So the technical support is very key on that side. Collaboration, of course. So within the frame of health information data is key to collaborate, because every day there is something new. Every day there are partners coming on board, and by working together, certainly we have more impact in different countries and area we are working. So, I mean, that the next will be certainly the last slide. Next, please. Thank you. And you have the link on this slide to visit the platform. I'll be very happy to have your feedback. After saying it, I'll come over to Patricia. Over to you, Patricia.
Thank you, Serge, for this amazing presentation. And thank you to Richard, Lawrence, Rachel, Gwen, for giving us a lot of insight on all the work you guys are doing. I think some of the things we've heard, and I grouped it in 3 key elements: country need, country commitment, and collaboration are the critical things to move forward. I'm gonna stop here because I think in light with time, we are not able to take the questions, and I'm gonna hand over to Dr. Benjamin. Thank you very much. Over to you, Dr. Benjamin.
Thank you, Patricia, for facilitating that session, and thank you to all the session presenters for very stimulating talks. It's unfortunate that we've kind of run a bit out of time, so we can't take Q&A now, but we hope within the course of today, we'll be able to recover that time and actually respond to any specific questions that come. Otherwise, also feel free to email or post your questions on the chat, and we'll be able to respond to that. So we very quickly move into our second session today, which is looking at making a case for investing in HDC. And without wasting much time, this session will have 2 facilitators. It will be facilitated jointly by Nicola from UK FCDO and Ernesto from GIZ. So my pleasure to introduce our 2 facilitators to take us through the second session of today. Thank you. Over to you, Nicola.
Yeah, hello everybody, and welcome to the 4th session of today, titled Investing in Country Health Information System, Making the Case, How and Who is Responsible. As Benjamin said, my name is Ernesto Lemke, and I work as a digital health advisor for the GIZ in Germany. And together with Nicola Wardrop from the UK FCDO, I present the donor constituency of the Health Data Collaborative. And we will guide you through the next hour. And this session will give us food for thought on using existing resources more effectively and efficiently to invest in HIS, to generate better data, which ultimately leads to better health outcomes. So without further ado, I would like to introduce to you our 2 speakers. Please welcome with me Shaida Badi, Managing Director of the NGO Open Data Watch, which monitors progress and provides information and assistance to guide implementation of open data systems, and Johannes Jutting, Executive Head of the Partnership in Statistics for Development in the 21st Century, which promotes the better use and production of statistics throughout the developing world. The floor is yours.
Good morning, good afternoon, everyone, and it's a pleasure to be here with Johannes to present this Making the Case to Invest in Country Health Information Systems with the help of the group that the RHIS. We prepared a set of slides for you to take you through this, this important initiative and sort of get your feedback and how we can proceed. Next slide, please. I think Dr. Tedros has said it very well that for us to build back better, we really need better and robust data systems, data and health information systems in every country and every community. So we're really using this building of robust data and health information system as sort of a guiding principle for making a case for this investment case. Next slide. I think throughout, I've been listening to some of the presentation. This is throughout, we've heard a lot of the statements of the problems with the data that we are facing. So, but for what's important for this presentation is that we would really want this investment case is going to be very specific and very targeted at identifying the problems that it would want to solve. And when we talk about problems, you know, many of these which are highlighted in slides, you know very well the problems of the data sources that are not strong enough. For example, CRVS, the data that is not interoperable. You cannot really bring data from one source and another source together. About the capacity of the country. So what's very important to note and take away from this slide is not that we only have data gaps, but we really have also gaps in using the data and in managing the data and linking it to policy decision-making. Next slide. So what's really important, back to Dr. Tedros's statement of a robust data system, that we really acknowledge when we talk about making a case for investment, that we acknowledge that we want an integrated and well-connected, interconnected data ecosystem. And that, of course, is the health information system is a very important part of it, but so is other elements of the data ecosystem, other administrative systems, CRVS, census, the household surveys, and other many non-traditional data that are now very important for the analysis and decision-making in the health sector. And it's really great to see, for those of us who are outside the health systems, and we're looking at the data, the framework for health information system. SCORE is really a wonderful framework to actually adopt, because it does include all this integrated approach that we're talking about, from all the elements of the SCORE, from surveys, from counting, from optimizing, review, and enabling. So this is an important part of the case, the investment case of this approach of looking at the integrated system and not just a piecemeal of looking at one element and solve that one problem. We've done this in the past before, and it just really doesn't work. You really, even if you want to prioritize a very important product from the health information system or a very specific area that you want to invest in, but you still have to look at the whole integrated information system and all the elements of the coordination and interoperability. So I hope if there's one thing you walk away as a message from this investment case, is that the approach that we are recommending would be an interconnected and integrated approach. Next slide, please. And the other thing about this approach that is very important to emphasize is we're not only talking about improving sources of data and improving gaps in data, but as is very well captured in this diagram from WHO, we're trying to address both ends of the data value chain or data life cycle, both at the collection level and improvements in collection and improving the gaps from the collection, but also in the use and impact of data. And this diagram also shows the important link between the collection and use through this feedback loop, and to be able to continuously get feedback from the users of data, whether the data problems are timeliness, whether they're quality, whether they're interoperability, and then also go back to the collection and be able to address those issues. Next slide, please. So far we've talked about the integrated, the data needs to be in an integrated data system. We need to pay attention to both collection and use, but also very important is we need better data to focus on for people to be at the center of this vision of the new data ecosystem. So better data for health outcome is tremendously important. And if we set that goal, then we would be guided by going with data that's open, data that's timely, and data that's disaggregated. So kind of setting that goal is going to help with the activities and with the investment case that we would make. And this slide also shows that we really need to put data to work for responsive planning, for addressing health inequalities, and proactively identifying trends and diseases. And hopefully in the investment case that we would be making, there would be examples and case studies where it shows that if you have open and timely and disaggregated data, it would really, like this case in Brazil that we have highlighted, it really can improve people's lives. Next slide, please. So many say, okay, we've always had this kind of problems and issues. So why now? I think one of the importance of making the investment case is that now is really an important time, and I think we all feel that this is a time for better data, better health information system, and better sort of coming together of at the political level, at the donors level, at the country and experts and technical level. So there's lots of opportunities. Some examples here is that we hear, for example, investment in data systems and as an emerging topic, particularly in the donors community through the work that Johannes does and OECD does through the Development Assistance Committee. We see that a lot of emphasis by donors on data, really a fresh new look as how they can work together to make the data to be effective for improving lives. We see at the RHIS working group has a strategy, which is really a very good way of unifying and bringing everybody around the table together. There are a number of new tools and funds that are becoming available. For example, the World Bank is starting up a new global data facility, and there are many of the new post-COVID funds that are being set up that could be used as building synergy with them. And of course, this group, the HDC objectives, and very important, the implementation of SCORE is an opportunity that makes now an opportune time for making an investment case in health information systems. Next slide, please. So to integrate, of course, we also need to integrate and keep connected the different stakeholders that we have in the health data ecosystem. And here we've highlighted some of the examples that we're talking about, not just Ministry of Health, but also Ministry of Finance, bringing together national statistical offices together at the country level with these other ministries, involving more of the bilaterals and multilaterals and global health initiatives, to connecting it more and finding opportunities for synergy. Private foundations, of course, are very interested and sometimes looking for opportunities to come in, and this may be providing those opportunities. And of course, private sector and civil society organizations who are both at the advocacy and at the technical level can make huge contributions. Next slide, please. So what are some of the elements of the investment case that we're looking at? Of course, this is a still work in progress, but just give you, to give you some of the ideas. You've heard us on the potential components that we want to make sure that we have a very clear problem statement, and that's why consulting with you, with the HDC, is really important in having that clarity of what is the problem that we want to solve. We want to, and this is really also getting feedback, we want to emphasize that on, what are the costs and gaps, but also what are the rates, what is the rate of investment and what is the return from the investments that we can make from this endeavor. And what are the costs of inaction? What would it cost if we don't do anything in the next few years, for data and investments in data? And then, of course, as I said, keeping the people at the center of the investment decisions is going to be critical going forward. On the potential recommendation sides, some of the items that we will be thinking of putting in the investment case is making a case for diversifying donors and recipients and use of existing resources much more efficiently. And I will mention that a little bit later. Using of all the types of different funds that are available, and also deploying different types of resources and supports that are available. And using this opportunity to build a coalition for better coordination. And Johannes will tell us a little bit about that in a second. Next slide, please. So what we are basically calling for is, we know that there is a shortage of funds, and we know that there are many competing priorities. So what we're really calling for is more smarter financing. Smarter financing means it's more than more funding. Is really better use also of existing funding and better targeted and efficient use of funds. So some of the elements that we are looking at is to increase the number of donors that should be prioritizing health information systems in their investment strategy, whether they are investing in a regional initiatives for building data systems or at the country initiatives. It would be a really great opportunity that health information systems is brought to their investment strategy. Watching for underfunded areas and countries as we talk about this integrated information system at country level. Maybe some countries need to invest more in some components that are critical for a robust health information system that needs to be highlighted. So we want to make sure that we do watch for what are the areas that have been underfunded. We want to advocate for greater domestic resource mobilization. We in fact see that for a sustainable, robust data systems in countries, of course, international funding is very critical, but the sustainable way is really for countries to allocate more from their resource for domestic resources to this initiative. And use of existing domestic and international resources more efficiently is really a big focus, that block, and we will tell you just a little bit more on that. And then reduce fragmentation, and we chose the word reduce because fragmentation will always be there. So we want to really reduce it and see whether we could, there could be synergies between different initiatives that could be explored. Next slide, please. So as part of this smarter financing that we're advocating, we also want to sort of come up with this menu of different types of funding mechanisms that could be used better for health information system, and for countries to actually know more about some of these options that they can access, but also the sponsors or providers of these resources maybe it can be more inclusive on supporting health information system. We talked about domestic resources. We talked about many of the loans and grants, and for example, large grant providing agencies like IDA, and loans from the different regional banks or international banks, bilateral grants where we have, of course, GIZ and FCDO here, which are really good in providing bilateral grants to countries. Technical assistance is a very important item on the menu of options for investment case. And also there are many multi-donor, looking at the health sector, there are many multi-donor or pooled trust funds that could be maybe better supporting the data initiatives part of health and building better health information systems. And also any emerging funds that are coming out or being structured, or any new initiatives would be inclusive of supporting health information systems. Next slide, please. Here, I'm going to hand it to Johannes to explain what we have in mind for the smarter financing for building a coalition for better coordination. But just wanted to sort of mention that this is a very critical part of our investment case. And the goal would be that we want to both help the countries on the demand side to do a better explanation of what they need, but also help the donors to allocate better resources. And this is a platform that Johannes and his team at the Paris 21 have already set up. So Johannes, if you could kindly take us through this slide, please.
Thank you very much, Shaida. Good morning, good afternoon, colleagues and friends. Just stepping back for a second and connecting to what Shaida has said. I mean, the interest in data, the interest overall in development data has significantly increased over the last years. So you can look at each and any sector in development, look at poverty, look at education, infrastructure. There's a phenomenal need for more and better data. And so it is in the health sector. And it's great to see all the different initiatives and all the different collaborations to strengthen the production and use of health data for the well-being of people. Now, within the overall context of development data, the topic of financing has come up as a very critical one. And we at Paris 21 monitor the support of financing giving to the developing countries. And you will see that overall speaking, the total percentage of ODA, of official development assistance to data and statistics is still less than 1%. So it's only a small fraction of aid given to poor countries. As Shaida has said, the question is, on the one hand, to raise more resources, more international support, and also, of course, in the health sector, given all the challenges that you are also well aware of, but also to raise more domestic resources, as well as also to allow for a better spending. We have, at times, we have financing darlings. There are some countries and sectors that are eventually overfunded, and in some countries and regions of the world completely underfunded. We just don't know. So this clearinghouse platform, which has been launched in October this year at the UN World Data Forum, you can visit it under smartdatafinance.org. This is something that we are currently building, and it brings together and it will try to solve the transparency issue. So on the one hand, has information on how much money is given by donors, in which sectors, and in which countries, very detailed information. And on the other hand, it has information on the demand side from countries. We currently have 4 case study countries, very detailed information where they have needs for more investment in their specific data strategies. So the offer from us here would be to look into, and as you can see, it's very small here, but there is in focus. We have within this smart financing for development data clearinghouse, we have one channel on gender already. And what we could think about is have one channel also on health, which could then cut across the specific issues around development data finance. There's no time to go into any detail. I know we are running out of time, but I really invite you to have a look at the site. It's in the beginning, so we have the opportunity now to develop the site as we see fit. But definitely one of the key issues that we need to address is transparency, it's accountability, it's coordination between donors and developing countries, but also in countries. Often, and as we have seen, lack of coordination in countries, and the clearinghouse could be a very meaningful tool to address those. So with this, I give the floor back to my colleague, Shaida. Shaida, back to you.
Thank you. Thanks, Johannes. And I think this is, we've seen the clearinghouse is starting to really be used a lot. And we see that it would be a very good platform for matchmaking between countries who use it to better specify their demand side, but also for donors to be able to find opportunities for investment. And also in the middle, we will be able to monitor the results, sort of actions. What are the areas which are progressing well, and some of the areas that need to be invested more in. So next slide, please. So in terms of our potential way forward, we do want to get your feedback for going forward, and some of the principles for going forward or suggestions is that we do not want to reinvent the wheel. Of course, Johannes mentioned that we have, for example, the clearinghouse. There's a lot of work that's been done in the past that we want to build on in terms of costing and in terms of gap analysis and making the investment case. We want to make sure that there is what we call leave no donor behind, as I said, to try to make this everybody's business. This issue of need for greater investment in health information systems should not be just a few donors, but it should be for really everyone to worry about. Cultivate custodians and use the energy among this group and among the RHIS working group to move this agenda forward. And then there is ideas on how to bring all the encourage knowledge sharing and bring some of the impact stories together and compile a state of health information system funding report to ensure that everyone comes together around on the same page. And so this funding report, next slide, please. The state of HIS funding for 2020 potential outline would be, as I said, built on existing information. They include some of the elements of the investment case that we have mentioned, like ROI and cost of inaction and cost of different types of support. The target audience would be that whole range of stakeholders that we mentioned, Ministry of Finance, bring them in, health, national statistical offices, and cover some of the areas such as the gaps in data and what does it take to close them and why is it important to focus on this issue now, and do a call to action and a possible set of steps for way forward. Next slide. So for today's discussion, turning it back to Ernesto and Nicola, is that we have some discussion points for your considerations. We are short of time, so I'm just going to hand it in to you because Johannes and I have a hard stop. We have promised another event to be there, so we will be with you for the discussion questions. And over to you, Ernesto and Nicola. Thank you for the opportunity.
Yeah, thank you both very much for your compelling thoughts and provoking insights. And I just want to build on your contribution and let me briefly present the donor perspective on that matter and provide some thoughts on the challenges to alignment in regard to HIS. So we have one issue would be the timelines and the competing priorities, as funding decisions may run on pre-specified timescales, which are determined by donor organizations and may not necessarily align with emerging needs and priorities. And secondly, many constituency members tend to embed support for HIS into broader health programs like reproductive, maternal, and neonatal healthcare. A set of priorities on HIS from purely a HIS perspective may not resonate as well as a broader discussion of how addressing specific priorities. And that would be also leading to my question, we still have some time left. So when HIS investments are increasingly embedded in larger health systems investments, how can we draw out the specific added value of support to HIS, including the knock-on impacts that HIS strengthening can have on a broader health system efficiency and health outcomes? Maybe you could give some answers to that.
Well, actually, I don't think neither Nicholas, neither one of us are really health information system experts. So that working together with the RHIS working group, we really have to dig deep into some of these issues and connecting to in making the case for how integrated system can benefit the HIS system. But we see that in all the sectors other than, not only not only health. We see that in all the different sectors that they're both advantages from the user perspective, because users, we really want the users to be much more looking at the holistic approach of information system and health information system, but also from the production side, there are lots of efficiencies, whether you're talking about digitization, you talk about, building statistical or data literacy. It's really the holistic approach can pay off in terms of not being very piecemeal, in terms of being much more integrated, looking at data systems. So, but we definitely need on very specific cases that you mentioned, and is how do we actually talk to people who really know deep down information systems in health and are really convinced, and I know many are very convinced that maybe integrated system is not specific enough for donors and specific enough for seeing the outcome of the investment. But how do we make that case that it really pays? There are returns on investment. Return on investment are higher when you look at the whole holistic approach. Johannes, do you want to add anything to that?
I think that's a very pertinent question. I actually had the opportunity in my academic life to work on health insurance and was looking into, from an academic perspective, how investments in health insurance systems, community-based systems and health insurance systems would be of value for society. And what you discover is it's very, very difficult to make any causal relationship between your specific investment and health outcomes. How do you want to measure if people are protected against health shocks financially, or they can get access to better health, they use insurance to protect themselves? It's super duper complicated. So what the literature says, what evidence tells us, is that the benefit for, if the objective is to protect people better, give them better access to health, and strengthen an overall health system, an integrated approach is often better. Yet the implementation in countries is a challenge, and for donors is often not so attractive. So I would perhaps turn the question back to you. How do you say, if we all are of the view that, or many of are the view that investment in broader systems is actually useful because we have a multifaceted problem. Many things that are concerned with health would also require data on other issues, like, for instance, education, water quality. So this is, of course, a question of how can we make a good investment case to be as specific as we need to be, while not making too many trade-offs in terms of the system strengthening that we need. And as we know, we need to do. So if you have any insights on that, that would be very helpful. Thanks.
At the moment, I don't have any insights, but I would like to refer to our Menti survey that we just conducted before this session, and gives also good feedback on what you said, Shaida, to have like a more holistic approach to that issue. So we asked our constituency 2 questions. If making an investment case for health information systems, which would be the most important thing or the first step to do it? So the majority said that a clear problem statement should be addressed that acknowledges fragmented approaches and decreasing efficiency of investments. And the second one would be causing the addressing of gaps of data. And the second question would have found very interesting also to see the answers is, in order of importance, should the target audience for the investment case be? And the majority said the ministries of finance. So this also shows us that we need to have a very sector-wide approach on that sense and really bring not only a health focus or health ministry focus on that, but we need the money behind it in these countries. And as a second target audience, it was mentioned to be global health initiatives like the Global Fund and Gavi. And yeah, these were the 2 answers that I wanted to highlight here. So also to give some feedback from the audience. But I think now the time has arrived that you need to leave us. But
can I say something before?
Yeah, sure.
I mean, because that's really exciting, and the point of what came out that this issue of donor investment and how we can the specific vertical funds, and there has been quite some work done on how we can convince finance ministers to make investments in sectors, and I think that's really critical. The health funds, the big health funds, have made a huge impact that we all see. The other question is really the sustainability. What happens if the donor goes away? What happens after 10 years funding from Gavi draws up? And how can we ensure that there is domestic resource mobilization? And here we have run several analyses in African countries. And for instance, Rwanda is a very exciting case where the Rwandan government over the years have really established a fairly functioning statistical system with a national plan, what we call an NSDS, a national statistical plan across the board, across sectors. And they've put a lot of funds into that, and they finance it. And then you can see the buy-in of policy making. The same case in the Philippines, another interesting country to look at, or Colombia for that matter. So I think you are spot on, and the audience as well, to look at how we can have this, the sustainability of building systems. If it's just for 2 or 3 years and then it dies, we will not have a long-lasting impact. But for many of the things we are looking at, we would need the political will, as we say, from governments to be convinced. Yeah, thank you very much. So very good point. Thanks.
And one last word from me. If anyone has any suggestions or improvements that we could make, or any questions regarding the presentation and sort of this base of what we said on the making investment case, we would really love to hear from you. And of course, Craig and other colleagues from WHO are to be connected. Thank you very much for the opportunity.
Yeah, thank you for your great contribution. And yeah, I'm looking forward for the next session. And I'm handing over to Benjamin then. Thank you, guys.
Thank you, Ernesto, for elaborately facilitating that session, and for discussers and presenters, Shaida and Johannes, for a very engaging session. I know Nicola has had a bit of technical challenges connecting, but has been participating on the background. So we are really running short of time now, colleagues. So we'll take this moment to take a brief health break. We'll just stretch, grab a cup of coffee, use the bathroom, and then come back again in 10 minutes for the last and final session for this meeting. So see you again in about 10 minutes from now. Thanks.
When a community health volunteer goes to a household, they register the households. Is there an expectant mother? Is there an under 5? Is there people with diseases? So it is my responsibility to look at the data, interpret data, analyze what has been collected, and plan for any action depending on the data that was being collected.
My main responsibilities in my community is to visit my households and to make awareness, like to talk with the young mothers and the pregnant mothers on how to come to clinic and how they can bring their children to clinic.
We have 10 CHVs in every community health unit. So that means for the 28 community health units, that is 280 CHVs. 280 CHVs, each of them take care of 100 households.
Yeah, it is difficult. The workforce also, we are very few who are supposed to collect all that data, put it together, interpret, understand, put it in the DHIS, go give feedback to the community. At times most of the time it is a very big workload.
It's a lot of work. You cannot even know which was where most of the time. But it's true, it's a big bulkage of papers.
How I would wish if actually everything was electronic. That would have been so good because it would actually also help us see and figure out and give us the exact information or help us in analyzing the data that we have.
So it will be my prayer if the government to come down on the ground and see the need, because we are serving a lot of community and a lot of things are happening. So one person is not able to maneuver all this work.
The volunteers, wow. The volunteers play a very big role that cannot even be measured through the data that we put in writing. The volunteers have changed humanity. They've actually helped the people down there in the community.
I'll continue because that is my talent, because it is inside my blood or inside my body. I'll continue and continue until my end of my life.
When a community health volunteer goes to a household, they register the households. Is there an expectant mother? Is there an under 5? Is there people with diseases? So it is my responsibility to look at the data, interpret data, analyze what has been collected, and plan for any action depending on the data that has been collected.
My main responsibilities in my community is to visit my households and to make awareness, like to talk with the young mothers and the pregnant mothers on how to come to clinic and how they can bring their children to clinic.
We have 10 CHVs in every community health unit. So that means for the 28 community health units, that is 280 CHVs. 280 CHVs, each of them take care of 100 households.
Yeah, it is difficult. The workforce also, we are very few who are supposed to collect all that data, put it together, interpret, understand, put it in the DHIS, go give feedback to the community. At times most of the time it is a very big workload.
It's a lot of work. You cannot even know which was where most of the time. But it's true, it's a big bulkage of papers.
How I would wish if actually everything was electronic. That would have been so good because it would actually also help us see and figure out and give us the exact information or help us in analyzing the data that we have.
So it will be my prayer if the government to come down on the ground and see the need, because we are serving a lot of community and a lot of things are happening. So one person is not able to maneuver all this work.
The volunteers, wow. The volunteers play a very big role that cannot even be measured through the data that we put in writing. The volunteers have changed humanity. They've actually helped the people down there in the community.
I'll continue because that is my talent, because it is inside my blood or inside my body. I'll continue and continue until my end of my life.
When a community health volunteer goes to a household, they register the households. Is there an expectant mother? Is there an under 5? Is there people with diseases? So it is my responsibility to look at the data, interpret data, analyze what has been collected, and plan for any action depending on the data that has been collected.
My main responsibilities in my community is to visit my households and to make awareness, like to talk with the young mothers and the pregnant mothers on how to come to clinic and how they can bring their children to clinic.
We have 10 CHVs in every community health unit. So that means for the 28 community health units, that is 280 CHVs. 280 CHVs, each of them take care of 100 households.
Yeah, it is difficult. The workforce also, we are very few who are supposed to collect all that data, put it together, interpret, understand, put it in the DHIS, go give feedback to the community. At times most of the time it is a very big workload.
It's a lot of work. You cannot even know which was where most of the time, but it's true, it's a big bulkage of papers.
How I would wish if actually everything was electronic.
Welcome back, everyone, to this, our final session for this meeting. And before we start, maybe I'll give a few seconds for people to get in back and settle. Great, thank you. I mean, in this last session, we'll focus our discussion on the status of the HDC, the status of the collaboration. And to facilitate that session will be Heidi Reynolds. So happy to now introduce Heidi Reynolds from Gavi, who will be the facilitator to take us through the final session of today. Over to you, Heidi.
Thanks, Benjamin. Pleasure to be here with you all today. Welcome to session 5. I am Heidi Reynolds. I work for Gavi as a senior specialist in evaluation and learning. I'm also on the Global Health Initiatives constituency. Welcome to session 5. This session is going to go over 3 items. For the first 2 items, Craig is going to review the milestones and activities for 2022 to 2023. Sorry, and before that, he's going to review the 2021 annual report accomplishments. There's been quite a bit that's been happening. It's been a pleasure to witness and be a part of it. And then move on to the milestones and activities for the 2022-2023 work plan year. And this is for decisions, so your input in this will be particularly important. And then we have a presentation on the regional alignment work, preliminary results by Nadej Ada and Serena Choi. Looking forward to getting an update on that work, which will help launch us into the next year's work plan. I'll stop there and turn it over to Craig.
Sure, thanks Heidi for the welcome, and great to see so many people on. So what I'm going to do in this presentation, this is really given on behalf of the Secretariat, so myself and Wenya and Alex, and it's a reflection from our side, looking backwards and also looking forwards to take action. And what we'd like to do is just reassure people, these are not finals, these are our initial ideas. There's a lot of background documentation in the Google Drive. If you delve into the Google Drive, you'll see a 2020 to 21 review. You'll also see the milestones. You'll also see this presentation that we hope will actually be get your approval and consideration in the January SRG. So what I'm going to do during this session, next slide if you can, is just provide you with some of the successes and opportunities in the last 2 years and some of the challenges that we feel we need to overcome. And then some of the strategic shifts. We're going to suggest 4 strategic shifts for the HDC, or focuses, that moves us on to kind of 2022 and 23 milestones. And after doing so, I'm going to hand over to Serena and Nadej, who are 2 UNICEF consultants who've been helping us really with their regional work on alignment as well. So next slide So we're going to start off with just some of the successes and opportunities. And there's a few of them. There's 2 slides on this. So in the last 2 years, we feel as though there's been an increase in HDC membership and the diversity of that membership, and the interest has generally increased. So for example, in September 2019, there were 28 institutions engaged with the HDC, and that just now is standing around 134, and it's actually 167 if you include the Digital Interoperability Working Group with that graph on the right-hand side. So we put this up just to emphasize the trend is looking positive, and there is increasing interest for different reasons. So the second thing we want to kind of celebrate, I guess, is also stronger multilateral cooperation. And one of the things I didn't put on the bullet points is actually UNICEF has been extremely supportive with ourselves in the Secretariat, supporting the Secretariat, supporting 2 regional consultants, as I mentioned as well. And as you heard earlier today from Rachel and UNFPA through the SDG Gap data and digital efforts, there's really a lot of increased interest in the way in which we can align efforts for data in the multilateral efforts as well. And over the last year and a half specifically, we had a lot more engagement with the UN Secretary General's data strategy in many different levels, and we've inputted into different documents and different plans, as well as the SDG monitoring group as well. The third kind of success I think is worth kind of celebrating is the knowledge brokering aspect of the HDC. And many of you have mentioned this to myself from Wendy on different occasions. And in the last year alone, we've had 10 HDC hosted events for technical tools or products that have gone ahead. And you've asked us, for example, can you use the platform as a way of sharing what you're doing? And the other thing that we're working on is the redesigning of the website, which I think is going to be done in the next 2 quarters in 2022. We've helped host 4 global partnership group meetings in 2020 and 21, 1 leadership meeting in 2020, and the Data Governance Summit, although it wasn't hosted by HDC, it engaged many of you as a partnership platform. So those were 3 successes that we thought was worthy of discussion. Next slide, please. The other 3 successes that we thought we'd draw your attention to is just really the re-emphasis, as you'll see in the documents and the reasons why we've done this, the re-emphasis on country-driven approaches. There's 5 countries that have now prioritized their data needs over the next 2 years. It's been a government-led process in each of those countries, and that's publicly available. It's also in the Google Docs, as you can see. For every SRT, we try and have a country update and really make it as country-driven as possible, so that our colleagues working in data in countries are really driving a lot more of our efforts and coordination. And you'll see also in the last year, we've moved towards regional coordination mechanism. This very event, co-hosted by Institute Pasteur and KEMRI as well, I think demonstrates that, and there's possibilities for moving forward. There are now 7 functioning HDC working groups, which some of us view as kind of the technical engines of the HDC. You can see them there. There's been increased membership. There's clearer deliverables now. And I think many of us feel the Digital Interoperability Working Group is a huge asset. It is by far the largest working group, and we need to kind of look at ways of connecting more strongly with the group. The last success we wanted to mention was just the issue of more systematic calls and coordination. We've really tried hard in the last year and a half to have a bit more systematic planning. We recognize it's by no means perfect, and there's a lot more work to be done. But just putting things in people's calendars, setting up the calls, the SRG calls, the co-chair calls, the working group co-chairs, and now we have Alex on board to support that. And we feel as though we're in a much stronger position, certainly than we were 12 months ago. Next slide, please. So that means, we celebrated some success, but I think we want to highlight some of the challenges that we feel might be worth overcoming and might actually be looked at from a strategic point of view. So some of the challenges we want to emphasize, one is the constituency-based representation of the HDC relies very much on the ability to engage in the representation of the representatives. So some of us are kind of referring to constituencies as the different tribes or groups in the HDC. And some of those groups, really 4, may need more support and have needed more support. There's really civil society. Spindley, our civil society colleague in Save the Children, was going to jointly facilitate this session now, but because of internet connection is unable to do so. our country constituency, the research, academia, and technical networks, and the private sector as well. And some of you have fed back to us that one of the challenges is actually understanding what the SRG does and what decisions are made. So that's one of the challenges to overcome. We've got a few solutions to propose in a bit. The second challenge we wanted to mention was managing expectations. So I mentioned that first, one of the successes is the prioritization of data issues in 5 countries. But that, of course, generates expectations and perhaps financial or technical expectations from partners as well. And there's expectations on the HDC Secretariat on how we deal with that. The HDC, I think many of us feel, can shine a light on the gaps, but ensure that HDC partners are aware of those gaps and look at possibly either investing or looking at addressing some of the gaps in countries. I think managing the expectations, I mean, currently the Secretariat has been 1.5 people for the best part of 12 months, and now we're kind of looking at expanding that as well. The third challenge we want to draw your attention to is this proof of concept for country impact. So a large part of the theory of change in the HDC is the ability for, number one, countries to identify and prioritize data issues. Number two, be able to coordinate with partners in countries to look at those issues and address them. And then third, see some commitment from partners to actually address the country identified data gaps. And that proof of concept is quite challenging for many different reasons. So it's a question of some of the countries have reported back to us saying, you know, we don't want to do our priorities anymore unless we see some commitment or change in behavior amongst certain partners. So that's one of the main challenges to overcome. Next slide, please. The 3 other challenges we'd like to draw your attention to is aligning digital health and data. So some of you have fed back to us that there's some common spaces within digital health and data as well. So if we were to draw a Venn diagram between digital health and data, there's a large intersection of that. Can we work more comprehensively within the Health Data Collaborative on data health issues and digital health per se? So there's a good example from Malawi yesterday, and my colleague Derek facilitated that session. And there's been some discussion today as well about certain digital products that could certainly be within the Health Data Collaborative and may need some support of some description. In terms of communications, one of the challenges that we've had is really getting a common advocacy thinking together for a common data agenda, and also using your partner communication advocacy groups as well. So we tried to do that with each of our leadership and then during the data summit as well, but it has been a challenge, I would say. And the last challenge we wanted to emphasize is a question mark. How do we scale up the HDC approach? We've got 11 HDC or 11 countries now that are definitely part of the HDC. How do we scale it up with real country impact at the heart of it? And that revolves around a large dose of trust between partners and ministries of health, but also in-country team liaison and the relationships between in-country teams, regional teams, and headquarters teams as well. And that takes a lot of effort to build up that trust and get the communication flowing as well. So one of the challenges we want to kind of raise was really looking at how can we look at channeling and aligning technical support with some of those approaches with country impact as well and scaling up in the future. It brings me, next slide, please. There are 4 strategic shifts that we're suggesting, again, for discussion in the next 2 years. One is we've heard from quite a few of you is there is a need for continuing increasing diversity, specifically geographic diversity and diversity amongst the constituencies, with more country voices, more voices from civil society, private sector, and the research and academia and constituencies as well. We heard from Rachel this morning that perhaps there's an opportunity to build on that relationship with the SDG gap and what we're going to be doing with the SDG gap as well. So diversity is a kind of a shift or a focus in the next 2 years as well. The other is with the increased use of the website and partly driven by our knowledge brokering aspect, but getting the communications right for political linkages, is coming up with a much stronger communications and advocacy strategy for the HDC and 3 objectives. And the third shift is that addressing the last challenge I mentioned is scaling up using regional platforms such as this event, but also supporting regional institutes and regional offices to provide a bit more of a coordination effort for scaling up for countries that can, obviously in the Africa region and the Asia region, but going beyond that in the next 2 years, can we look more broadly at other regions? And clearly, many of you have mentioned we need some to be supporting many more fragile contexts, for example. And then the last strategic shift I wanted to draw your attention to is we heard from Johannes and Sheda in the last session about a possible investment case. That many of us feel that now is the time with the political opportunity, and there's a technical opportunity as well to make this case for strengthening country-based health information systems and possibly align that with some of our score work as well. So those are the 4 strategic shifts that may well drive some of our work plan. Next slide. What I'd like to do very briefly in the next 3 slides is just take you through the work plan at a very high level. It's available on the Google Drive if you want to read it in more depth. But if you recall, the 3 objectives of the HDC, number 1 is really all about strengthening country capacity of the health systems. Objective 2 is the alignment of resources around those priorities. And objective 3 is contextualizing global tools with local contexts and adapting them. And then we have a 4th objective in the work plan, which is much more around the governance and the functioning secretariat. So for the first 3 objectives, what we're looking at is to try and put country teams and identifying and supporting 5 different things for the first 3 objectives. Is basically every country should have a government-led partners coordination mechanism, which we understand is in place. Secondly, a national data institute for capacity building. Third, 2 to 3 data digital priorities for the next couple of years, a data or digital champion, and data and digital tools that are used or adapted to local contexts. And the milestones for this objective specifically, we're looking at finishing off the work undertaken by Diane and colleagues and guided by UNICEF on the COVID-19 country cases, some good practices for tracking communities through the community working group. An Asian Institute hosts the next global event in Q4 in 2022, and then perhaps another regional institute beyond Asia or Africa host the event at the end of 2023. And you can see some of the products from the RHIS working group and CRVS working group that are on the work plan for that as well. Next slide. So objective 2 is pretty much the same. It's really putting countries first and foremost with a large number of activities for country-based teams. And the milestones are much more around the regional data institutes are identified in all 6 regions and looking at modalities for supporting them. That we look at the RHIS strategy and support the working group in disseminating that strategy and look at specifics, again, working group outputs from the CRVS and the community working group as well. And perhaps an analysis of initiatives, better detection and response from the public health and emergencies working group. Next slide. And the 3rd objective, as you can see, again, puts countries at the heart of what we're doing and looks much more around the working groups and a lot of the working group outputs there as well. And then the next slide, which is just about the objective 4, which is more the functioning of the governance processes and the structures in place. So that's much more to do with the secretariat and how it functions. So there's 5 activities that we're suggesting. One is the HDC and SDG gap governance calls take place and there's follow up for them. There's a biannual event, the global partner event. There's a functioning website and this knowledge brokering function, and perhaps suggesting monthly webinars where you have an opportunity to use this platform as a way of sharing tools and good practices. With quarterly reviews, and the work plan is linked very much to UHC 2030 and SDG gap goals as well, but ultimately accountable to the SRG, which is your group of representatives. And there's milestones there that you can see there. And I wanted to draw your attention to commissioning and implementing an independent evaluation of HDC, and the independent evaluation we're suggesting is the tail end of next year and could be implemented in the first 2 quarters of 2023, which could really help better inform and perhaps redesign the HDC for the next few years leading into 2030. So the next slide. So the last slide is really to stimulate some discussion, and it's just some thoughts that we would value your inputs into between now and the end of January. Are you in agreement, or what do you think of the strategic shifts? What do you think of the milestones and the activities? One of the biggest challenges is this proof of concept that I mentioned. Do you have any suggestions on strengthening that? and monitoring impact. So every quarter we will produce a monitoring report for you to feed back onto as well. So with that, I just wonder whether I could hand over now to Serena and Nadej, who are our colleagues working as UNICEF consultants to support the alignment agenda. So over to you, Serena and Nadej. Thank you.
Hello, good morning, good afternoon, good evening. Thank you, Craig, for that. We're very happy to be here presenting on this. My name is Serena Chong, and I'm, as Craig mentioned, I'm a consultant hired through UNICEF to support HDC with some country work in the South Asia region. And Nadej, who is presenting with me on this session, is also a consultant working on the same thing, but in the Afro region. And our work involves looking at the alignment piece of HDC, specifically on the alignment of partners' technical and financial investments for stronger data systems. Could I request a slide switch, please? Thank you. So we thought we would, well, we thought we would present today on why we are working on this. So why HDC thought that this piece of work was important. We also wanted to outline a little bit our conceptual framework, how we're conceptualizing and thinking about alignment. We'll talk briefly, if time allows, about some preliminary findings from our countries. And then we will then end by talking about some potential directions for future HDC work and engagement in these countries that we are working on. And so as a start, Nadej will talk us through the whys and hows of our work and our conceptual framework. Over to you, Nadej.
All right, thank you, and I hope you can all hear me well. Regarding the whys of this work, I think it's important to first state why misalignment is a problem. First of all, it's a waste of resources because we're duplicating activities. Second of all, it hampers the ability of countries to coherently create, capture, analyze, and use data for health improvements. And second of all, it also involves overburdening healthcare workers. They have to report on multiple surveys and tools. And in a way, it's also unethical behavior because with scarce resources, we have to maximize outputs, especially if this involves improving the health of populations. So the goal of these, the objective of this consultancy, as Serena mentioned, was to understand how partners are aligning and the extent of alignment of their technical and financial investments in the Afro regions. The countries here include Kenya, Cameroon, and Zambia for Afro, and for the South Asia region, it is Nepal and Bangladesh. The idea here is to support partners and countries to think through strategies that can improve alignment for stronger and sustainable health information systems. Next slide, please. Slide 4 on the conceptual definition of alignment. So here in this work, we have conceptualized alignment in terms of 3 domains. First is the policy and regulatory alignment. So this is where partners' activities are linked to the National Health Information System Plan or strategy or any other key policy documents that the country has. Partners' activities are also linked to the National Monitoring and Evaluation Plan to monitor outputs and the results of the health sector. And partners' activities are also linked and they work with the national coordinating legal or regulatory body that has been put in place to coordinate the work of partners. So partners actually work with this national coordinating body. In terms of the systems alignment, we conceptualize this in terms of partners integrating and synergizing their activities, the technical capacity building activities and remunerations at country level. We also thought about these as partners integrating and synergizing their finances for strengthening all aspects of the health information system, which includes the CRVS, the HMIS, digital health, community health information system, and other population surveys that could be carried out, and also the laboratory health information system and the logistics health information system. Systems alignment also involves integrating and using similar data collection tools, standards, indicators, and typologies. Finally, our last domain of alignment involves the operational alignment. So once we have policy systems alignment, well, this is not really sequential, but it doesn't have to be sequential. But once we have policy and systems alignment, then we expect to see operational alignment on the ground. So we expect to see partners coordinating their activities in certain geographical coverage zones. So there is no duplication of activities in certain regions, in districts or villages. And there's a sequential and a coherent time frame in the way partners implement activities where they build on each other and build on the successes and learn from the failures of each other in the time frame. Next slide, please. And I'll hand over to Serena.
Thank you. So today I just wanted to share some preliminary findings from Nepal. So I'm working on 2 countries as case studies or assessment countries in the South Asia region, that's Nepal and Bangladesh. And we're at the further stage of this work in Nepal, which is why I'm focusing on Nepal for this. So in Nepal, when applying our conceptual framework, and looking and in reviewing documents and looking at indicators for the HIS, talking to stakeholders in the countries, multilaterals, bilaterals, NGOs, it is clear that Nepal has strong HIS policies, strategies, and systems, especially at federal level. The government of Nepal employs a sector-wide approach, a swap approach for the health sector, and that I think has greatly encouraged alignment by partners with national priorities. This is true to some extent, down to the subnational and the provincial level. But what I'm finding is a little bit less clear. And again, these are preliminary findings, is how data systems and reporting are aligned at local level, and how that data is used at local level, whether by health facilities or by community organizations providing services. And in general, there also seems to be a bit of a lack of clarity around how data is shared between organizations or partners and how it is used. So then looking at the systems part of our alignment framework, the Nepal's health sector benefits from a pooled funding approach that's part of the swap approach, and also strong government ownership and close involvement with development partners. There is a development partners working group, there is a strong national M&E framework, and that's supported further by a specific M&E technical working group that's coordinated and led by the Ministry of Health. There are also other coordination mechanisms, such as various technical working groups across the health sector, and this promotes partner operational alignment. So partners through these mechanisms are able to participate and contribute to sector strategic reviews and policy development processes. So it seems that at federal level, where the decision makers are, information flows seem to be fairly robust. But that said, and again, at a subnational level, at a provincial and a local level, there are no such formal coordination mechanisms to include and integrate local level partners into the broader HIS ecosystem and framework. And this is actually a stated priority for the Nepal MOH to strengthen HIS and M&E coordination mechanisms at provincial levels going forward. It also seems, and I noted that this was also mentioned in a couple of previous presentations today, that there are multiple parallel reporting and recording systems for the same types of programs in the health sector. And from stakeholders, this is reported, I guess, to be donor-driven, as donors do sometimes request indicators that are specific, and which are maybe not necessarily included in the national RHIS. So yeah, and I just wanted to emphasize also that all of the countries we're working on right now are quite different. They've got different contexts. There are different stages of development of the HIS, and with these preliminary findings from Nepal, and this is not quite finished. I'm also at the inception stage of this work with Bangladesh, and I cannot share findings from there yet. But Nadesh will also now talk about her findings from the Afro region. Over to you, Nadesh.
Thank you, Serena. Okay, again, I'd like to stress that these are preliminary findings because we're still in the consultation process with stakeholders and also looking into more document reviews and literature review. So we're on slide 6. So in terms of good practices, and this is organized in terms of the policy or conceptual framework, the policy alignment, systems alignment, and operational alignment. In terms of the policy alignment, what seems to be coming out from the countries, 3 countries, is that there exist key policy documents. So the policy documents are there, and the national documents, and they're known. So, so for example, in Kenya, we have the data digital health policy. We have the monitoring and evaluation framework for the health sector strategic plan. In Cameroon, we have a national work plan for the community health information system. We also have a national strategic plan for digital health. So we have these policy documents and partners know about them. It seems that depending on the domain in which the partners work, they would reference one specific document. So if the partner is focusing on community health information system, then they will talk about that document, that policy document. And so there are many policy, it seems there are many policy documents. While this is a good practice, a key question comes up as to how interlinked or how related are these different policy documents within the broader health information system to ensure that there are clear priorities that all partners know and they know where they're headed. And it's all integrated into one big health information system policy. That's a question. It's not a fact, it's a question. So that's a good practice in terms of the policy alignment. In terms of the systems alignment, the broad perception that seems to be coming out from countries is that there is strong alignment, technical alignment in certain components of the health information system. For example, the DHIS2. Here, partners are working collaboratively with other partners on the ground to have a strong DHIS2, to have a strong community health information system, and to avoid duplication of activities on the ground. Again, this is the technical aspect in terms of data tools. That seems to be coming up, but this has to be digged into further. What seems to also come out from the systems alignment is that the broad components of the health information system are being strengthened, although there was not much information on the laboratory health information system or the logistics health information system. But for the rest, partners seems to be working in those areas. In terms of the challenges, good practices on operational alignment so far, I haven't yet gotten any, but it's in terms of the challenges. And here a key question that seems to be coming out from some of the countries for me was whether partners actually fund specific activities they're interested in, or whether they actually align into country priorities. For example, in one country, one key actor mentioned, counties have different plans based on the partner supporting them. So in one county, you could have more than 2-3 plans for the health information system. And so this begs the question of whether the partners are actually supporting the priorities in the counties or of the country, or they bring in their own activities, and then counties are aligning to that, to the activities of partners. In terms of the policy alignment, what was also unclear at country level in Cameroon and in Zambia, for example, is that there was no clear, well-known coordinating structure for the health information system. So while some actors would broadly mention, for example, key policy meetings, key instances for discussions of policy issues, there was no clear understanding or knowledge of a coordinating body for the health information system. This was different for Kenya, where it was very clear that there was a structure, either technical working groups or the interagency technical committees for the health information system. So this regulatory and legal regulatory coordinating body for the health information system wasn't very clear in some countries. In terms of the challenges for the systems alignment and specifically for finances, this was coherent all over the 3 countries in terms of having internal piecemeal and programmatic approach to health financing, to health information systems financing. So the grants will come when they come. And then sometimes grants will come when partners already implementing certain activities. The finances were based on programs. And so they were dispersed, the funds were dispersed in terms of programs. And so it was difficult to capture the investments, the financial investments for the health information system, because either they were passing through different programs, or they came at different times, it wasn't clear. It wasn't a very clear structure in terms of any clear investments for the health information system by partners. So one of the key phrases that I found interesting from one actor was that support is all over. We cannot coherently get it into something clear in a document saying this is how much we're investing, this is how much we know that we're investing in the health for the health information system. So it was all over basically. In terms of the challenges for operational alignment, there was all over the countries a poor perception of operational alignment, although partners are collaborating, and this is something that is intriguing. Partners do collaborate. So the partners would say, we're collaborating with these actors, we're collaborating with the Ministry of Health, and they know about the partners they're working with. But then there was a sense that at the operational level, there was lack of alignment. And so the key question is, how come there is collaboration, but then there is still lack of operational alignment? And an issue here was the lack of cumulative gains. So while there could be some gains, there was lack of joining forces to get something cumulative, to have a cumulative effect. And one of the key phrases that one actor also mentioned was the need to regroup and to have a hands-on team approach. So this aspect about collaboration and yet not having operational alignment is something to be digged into further, and why that is the case needs to be understood. But there are enabling factors that could help, that could be used to improve alignment. For example, the fact that in some countries there are existing structures, coordinating structures, even though they are not specifically for the health information system, they could be used and strengthened to support coordination for health information systems. Certain countries also have capacity assessment gaps for the health information system, and these could be used to align partners to support those gaps that have been identified. And this aspect about collaboration between partners, so partners do collaborate, but then why are we not seeing effects on the ground? I think much needs to be digged into the structural and the organizational structure of each partner. They work within the structures, they work within the ways of doing, and these are different ways of working, and these translate on the ground to leading to lack of operational alignment. So broadly, these are some findings. Again, they're preliminary, and this is what we have so far. Thank you. Next slide.
Yeah, so in terms of potential future work in these countries, in Nepal, and this is not groundbreaking, but in line with MOH priorities, I guess their HDC and partners could look at how to best support the development and strengthening of subnational coordination mechanisms to promote alignment. And again, I think that with the harmonization of health sector indicators and reporting, HDC and partners could also potentially look at how to support, I guess, a review of the health sector indicators, to what extent they can be harmonized so that there is a more streamlined set of indicators, although recognizing also that donors sometimes do have some specific indicators that they need information on. And then this just will generally help to reduce reporting burden. And there could also be some support for capacity building along these lines as well. And finally, and this is a broader point, I think it would be interesting to see how data use policies and practices can be aligned to support more evidence-based decision-making, not just at federal level, but also to empower the provincial and local levels, the health facilities, the community organizations to do that. And for the Afro region, Nadej will give some reflections.
Regarding the Afro region, some preliminary reflections here, preliminary like to state, is the fact that, and this is part of some of the work that I would continue to do, there needs to be a deeper understanding about how partners' internal structures of work constrain or hamper alignment. We need to get, there is something to be digged into there about how each partner's internal organization, both at global and also at country level, ways of working and ways of obtaining grants and ways of disbursing grants on the ground facilitate or hamper alignment. This is not about changing the whole aid architecture, no, but this is about looking specifically into what can be done and what cannot be done. The second point here is to be able to develop a standardized plan or tool to measure key indicators on alignment and how, well, to assess current level of alignment and then be able to measure progress over time. And progress could be in terms of a basic level of alignment that is needed, an average level or coherence level of alignment, and then a good level of alignment. So propose indicators to be able to measure this over time. Next point here involves potentially developing an operational plan to support countries. Maybe this is what the HDC can do to support the health coordinating structures within countries to facilitate coordination between partners, and thinking about the role of the HDC in countries and the existing coordinating structures. So the link between the HDC and existing coordinating structures, how can they work together to enforce alignment at country level? So these are some preliminary points to be developed later. Thank you.
Thanks, Craig, Nadej, and Serena for those presentations. Very interesting work. And I'm particularly impressed to see the many accomplishments in 2021, as well as the ambitious agenda that's set forward. And just would like to take a moment to appreciate how far the HDC has come over in 2021, and want to acknowledge Craig and Moana for their support at the Secretariat. There are a lot of people contributing to this work, but they are carrying a very heavy load, and it's evident in what's been accomplished. All right, so we're in the question and answer session now. So please go ahead and put in your questions and we'll get to them. There are already a couple that have come in. One is from Philip Settle. The alignment work is very interesting. Does the scope of the activity also align with the components of SCORE? So perhaps, I mean, I think this is for Serena and Nadej, but happy to also have other points on this.
Yeah, so I guess I'll jump in on that, and Nadej can also fill in. Yes, the SCORE framework is a good basis for preliminary assessment of the country's health information system, and we have used that along with other types of frameworks. I guess there is the measure, evaluation, assessment of like the state of a country's health information system. There is also our own work on how we have conceptualized alignment. So we have kind of used these different frameworks to look at first how the status of the country's health information system, and then we have pulled out the parts that we've kind of organized and pulled out the parts pertaining to alignment according to our framework, and delve deeper into that in our stakeholder consultations and interviews. Nadej, did you have anything more to say about that?
Yes, which is basically that we use the SCORE framework to actually develop the conceptual framework and alignment to include the broad elements of the health information system. So that has been used, yes.
Great, thank you. There's another question here from Mohammed Noor. How could you align efforts in a country when existing structures are not accountable for engaging others?
That's a great question. And again, Nadej, I think that's for us. And again, in my work in South Asia, I don't think Nepal is maybe a great country for this question, just because the actually partners in the country seem to be fairly well aligned, or at least they understand the importance of alignment. So, but where there aren't those incentives, and I think those have to be somewhat donor driven. Those have to be somewhat constrained also by national policies and framework. I think potentially there needs to be some donor and national Ministry of Health-led incentives to support that kind of alignment or to promote that kind of alignment? Nadesh, do you have any reflections from the Afro region? I would be interested to hear as well.
Yes, no, the question is how the accountability element of it. And this is where the policy and regulatory aspect of alignment comes to question, the regulatory aspect, because the policy documents exist and we'll expect partners to align to the policy priorities, but maybe that's not the case and maybe they don't collaborate in certain countries. Then the regulatory aspect comes into place. Are they legal and national coordinating bodies that have the authority to bring these partners on the table? That's a key question. And if they have the authority, do they have means to sanction? I don't know, if certain partners do not collaborate. So there's a legal aspect or a regulatory aspect that needs to be worked into, and even in our own work, that needs to be improved upon at country level. And this is also linked to the measurement. So when we're going to develop tools to measure alignment, this could be a way to bring about accountability, because if we see certain partners, they don't align on certain indicators, then they have a poor performance, basically. And partners don't want to have a poor performance, especially within this current era where we need cooperation and not competition, and we need to be working together. So I think the measures on alignment could be one way to also bring about accountability, because then partners will be sort of forced to do a good job because they've been measured on their performances, basically. Yeah.
Yeah, thanks for that. It's really interesting work, and it does have wider relevance for alignment in other areas beyond health information systems. Again, if anybody has questions, please put them in the chat and we'll get to them. And I would definitely call on the different constituency members as well, especially since part of this session is related to the annual report and the work plan for the next year, which have implications. Would be interested to hear if there's any feedback on those. In the meantime, I have a question myself. I'm wondering, I'm very interested in this work at the regional level, in this regional platform. And I'm wondering, maybe Craig, if you could expound on how that the regional, building out the collaboration at the regional level will lead to an improved partner alignment at the country level.
Thanks, Heidi. And I can give you a personal perspective, but really value people's thinking. I hope we can have an in-depth discussion in January's SRG. But there are three elements to my thinking. So one is there's a low-hanging fruit already. So the multilateral offices of WHO and UNICEF already are collaborating on a number of different issues. And I would like to see the other multilaterals, including UNAIDS, including UNFPA, joining that, where we have more regular calls. And I know on ad hoc kind of projects and issues that does happen. But I think, and I've seen it with the WHO UNICEF collaboration, it has happened and it has helped really strengthen the joint messaging with country teams on the multilateral side. So I think there's an opportunity there. And just with this bit of work, considering Nadej and Serena, and a huge thanks to Jennifer, who's on the call just now as the co-chair, kind of the UNICEF collaboration with that has really, in my view, worked really well. The second aspect to it that I think is kind of longer term and looking at the regional institutes. So it'd be great to hear from Institute Pasteur and Kemri later on today on their thinking of the future. But our thinking was to stimulate this collaboration where regional institutes have a role in advocacy for data, and data is a global good, capacity building for data issues, and possible technical support for individual countries, aligning around the gaps identified by countries in those data issues. And then lastly, just through the regional, using a regional context for coordination, if we could kind of move in that direction, it would help scale up, or I think, better scale up the numbers of countries and the diversity of countries with a much more context-specific approach compared to, for example, headquarters or entities who are based in, at HQ level. It's much more context, and our regional colleagues are much more aware of the political nuances, the dynamics of different countries, and could provide perhaps much more relevant support. So those were kind of three aspects of our thinking, Heidi, if that helps answer your question. But again, value others as well. But I think the crux to the solution is actually institutional capacity building at regional level. And that's the reason why we're being quite strategic and trying to support and look at in the next 2 years how we can best work with regional institutes. Thanks, Heidi.
Thanks, Craig. Yeah, very interesting work. All right, I have another question here. It is, how were coordination and alignment defined by informants that they considered different? And this is from Deborah Jackson. Thanks, Deborah.
Sorry, could the question be repeated?
Sure. How were coordination and alignment defined by informants that they considered different?
Yes, how was coordination and alignment defined by informants and what they consider different?
I think that's what, yeah, like the people you spoke with is the way I would interpret that, yeah.
Yes, okay. At country level, alignment was really defined as cumulative gains. So when we think about alignment, what do we want to see? What is the end goal? The end goal is cumulative gains, something that could be added. Alignment was also defined as a teamwork approach. And alignment was also seen as ensuring that there is one plan, one implementation, one monitoring tool, if that could be feasible. In terms of coordination is what leads to alignment, I would say. So it's a preliminary step for alignment. Maybe that's the difference.
Thanks, Nadej.
Yeah.
Serena.
Yeah, from Nepal at least, I think, as Nadej mentioned, coordination is seen as one component of alignment. In Nepal, alignment was definitely regarded much more as strategic alignment. So how are an organization's goals in this sector aligned with national goals? How are they aligned with national development goals? Is there some kind of a unifying framework for the strategy and policies? Whereas coordination for us, and certainly in my sensing for most of the people that I spoke to, coordination was regarded very much as an operational piece of alignment. So how does one coordinate activities? How do you coordinate what you're doing with another partner to ensure that there's no duplication of efforts? How do you coordinate your reporting to ensure that, that your broader reporting goals and your outcomes are aligned with the national strategies? So that's kind of quite similar, I think, to what Nadej has said already.
And there is also something to be looked into deeper and to be understood about how come there is collaboration, because there is strong collaboration on the ground, but how come that collaboration doesn't translate into cumulative gains and doesn't translate into a sense of operational alignment? And I think that's something key to be worked into and to be understood.
Thank you. We have about 6 minutes left for questions, so I'd encourage people to put more questions in. Maybe in the meantime, Craig, I had another question regarding the work plan for next year, and you had mentioned briefly a view to data systems in fragile and conflict settings. And this is sort of wearing my Gavi hat, where there's a lot of alignment and interest in reaching those communities who have been missed previously by health services. And many of them are in fragile and conflict settings. And we know that those settings require different data strategies to be able to generate information, not typically reached by the sort of more traditional approaches we might find. Can you speak to a little bit about how the work plan and some activities may be getting a bit more granular and differentiating on some of these different country contexts?
So I think first off, Heidi, I mean, the HDC is obviously open to any country that wants to join the HDC. So we're actively kind of encouraging countries from different contexts to join, and specifically in discussion with our colleagues from EMRO, where a lot of displaced populations live. That's basically the Middle Eastern countries, our emerald region, and whether some of those countries want to join the HDC. So that would be the first step. And the second step was in our view, a lot of the data that's collected specifically from the populations and communities you're mentioning, as we all know, are collected often by non-governmental mechanisms such as NGOs or private sector or where government infrastructure is less than strong compared to other countries. So it requires, and this is one of the reasons why we're very keen to strengthen the constituencies with our civil society colleagues, specifically IFRC, MSF, and ICRC as well, and some of our private sector entities as well. So that's the second step, is basically through our constituency mechanism, can we strengthen those? And then thirdly, having engaged potentially one or two fragile context countries, can we look at what the needs are and have them go through a situation where we support the data and digital priorities in the next 2 years and look at the gaps, quite frankly, in a partnership approach with country teams and look at what can be supported and what can't. But I would say that the challenges we've had with the other 5 countries to do that has been significant. So I think the challenges in fragile settings may be more complex. So some of us are thinking, well, why, with the 5 countries that have identified the priorities, to try and support them or address their gaps potentially before moving into more complex situations. But I'm just reflecting some of the discussions. But from a personal perspective, I think if we had 2 fragile contexts in the next year, that would be fantastic. And we're really actively working as a partnership to address data and digital issues in at least a couple of countries. But those are personal reflections. It'd be great to hear in the SRG in January people's thoughts. Thanks, Heidi.
Thanks, Craig. There's a question here from Adele Wogman. She says, it occurs to me that there are many entities asking countries to share their health system digital transformation progress and needs. And there is not yet a common repository where such information is being widely shared. I'm curious to hear the speaker's reflections on this and how we might seek to address the gap in the future. So perhaps this can go to any one of you or all of you that would like to answer.
Okay, I'll jump in. Since this relates specifically to data and digital health, I think I will say that in our work we have, or at least I have specifically tried not to focus too much on that in Nepal, because there are other partners working on that already, and UNICEF is actually already doing some work on mapping of digitalization in the South Asia region, the Southeast Asia region. And I did not really want to duplicate that work, or at least I wanted to see where to let that work take its natural progress at its pace, and not jump in on that. So in the South Asia region, that is ongoing. There is some work going, I think, on trying to standardize that, and I believe that USAID also has been doing or funding something similar. There is a digital square mapping project, I think. So that's going on, and from conversations with stakeholders in country, that have also been engagement with country stakeholders on this. So yeah, while that's not something that we're specifically focusing on, it is something that we're certainly aware of, and we're looking at more broadly. Nadesh, do you have any reflections from the Afro region, or Craig?
I'm sorry, I'm really having difficulties on this, like hearing the question. If you could, the question could just be repeated, please.
Sure, it's related to related to the potential for, there's a gap here related to where people can access countries' digital health system digital transformation progress and needs, and so there's not a common repository. So how might we address that in the future?
Yes, thank you very much. That's a very tough question that I do not have an answer to. I am not aware of any work that is being done to centralize all the digital health interventions that are currently occurring within the countries I'm working on in Afro. Potentially there are something going on, but I haven't looked into that, so I cannot answer that.
Thank you very much to all the participants today for your really interesting presentations. It's time now that I turn this back over to Craig to go over some actions and responsibilities.
Sure, thanks, Heidi. So just a bit of a reflection on today, and I think number one is just a huge warm thank you to our colleagues in Kemri in Kenya, and also our colleagues in Institute Pasteur, and we'll be hearing from them shortly on their reflections on how best to take forward this regional approach and building regional institutes and what they feel their roles are. So that was number one takeaway from today was that, and it'd be great to kind of hear from them in a bit. The other take home that I had was really in the session 3 that was on the context. It may have appeared to some as a smorgasbord of different initiatives presenting one after the other, a bit like speed dating. And we specifically wanted that in a way because it demonstrates the variety of initiatives and potential collaboration that can go on to strengthen data in many different ways. So we encourage, so the other takeaway was we encourage everyone to make a link with those different initiatives you heard from. And then maybe in January's SRG, we reflect a bit more about how we do that systematically and collaborative. I mean, the 2 strategic areas that I think many of us picked up on was the SDG gap and of course UHC 2030, because the HDC is a UHC 2030 initiative. And I think the take home from the next session on investing in country health information systems was it's obviously complex, and it's not just about new resources, it's making better use of existing resources from they have, and it's not just about money, it's about technical resources as well. But moving ahead, our take home was this is an initial step in the direction of an investment case, and we put on the work plan to commission and possibly make an investment case with the target audiences that were highlighted in the first quarter of next year. So the investment case work will probably move ahead, but we value, again, inputs into the thinking for that in our January's SRG. Then this last session, the take home from our side is really, we encourage you to go into the Google Drive, read the annual report, have a look at the milestones and activities. Are you in agreement or not? And if not, then let's craft it together and really look forward to January's SRG for either your approval, suggestions, send them to by email to Mwenya and myself on the milestones and the activities for 2022. And then lastly, I think what generated the most chat, I think in the whole 2 days so far, is actually Nadej and Serena's work at the regional level, which again, kind of I think emphasizes the need for more work on alignment and what's happening at regional level. Some really interesting granularity happening in terms of the understanding of the dynamics of the different countries. So hats off to Nadej and Serena. Again, thanks to UNICEF for supporting that work as well. So those are the take homes so far, and thanks Heidi for facilitating. I think I'm handing back over to Benjamin at this moment of time. So back over to Benjamin, and thank you Nadej and Serena for supporting this, and Heidi for facilitating. Benjamin?
Great, thanks Craig for the summary of that session, and to Heidi for ably facilitating that session, and all our presenters. I think everyone would agree with me, this probably has been the most engaging session, really, not just today, but for the entire 2 days we've had a conversation. Of course, I mean, a lot of reflections there in terms of discussing action points and immediate plans for the network, and openness to participation and engagement. So I'm hoping that people will take this conversation or the enthusiasm that has come from this session beyond this session, so that we continue engaging on how to strengthen the activities and aspirations of the network. So as we're now moving into the wrap-up session, I am not seeing my colleagues online, my colleagues from Institute Pasteur, but I mean, I was asked to make some reflections of what has transpired in these meetings, but also what I see, or what we see from our team in Kemri, but also on behalf of the other regional partners, institute partners. on what we see our role will be and what kind of nature of conversation and partnership that we need to develop and grow and nurture as we move forward with the aspirations of the collaboration with the aim of supporting data use for decision-making for betterment of health and health outcomes within the region. So just to very, very quickly, maybe in about 5 or so minutes, putting in my personal reflections, to start with from where we've just ended. And we've spent a lot of today talking about or reflecting on the richness of the ingredients of the collaboration and the potential that it has in terms of supporting or providing the much needed support for strengthening data and information use for decision-making within the African region. And also we've heard of the richness of the wide range of partners beyond the region, especially on the global level, who we could tap onto their various levels of capacities to support our unique regional specific needs and demands. But I think also worth noting and reflecting on the discussion that happened yesterday is that we are not starting from a vacuum. We heard yesterday that there's been lots happening within the countries, and we got some reflections and sharing of best practices from Kenya. We heard of the unique partnerships that is happening between the Ministry of Health Kenya and the Ministry of Interior to strengthen CRVS data capturing and use systems. We heard about the unique partnership for developing and strengthening community data systems in Botswana. We heard about the progress in supporting and improving digital health systems in Malawi. We heard about the progress in strengthening routine HMIS in Cameroon and Burkina Faso. And I think for me, the take home from all those, apart from just getting a snapshot of what's going on and the richness of what's going on in that country, I think for me, what was really, really fascinating in all those is the centrality of the leadership of government and particularly Ministry of Health players in terms of both driving the agenda, but also defining the priority needs, even within the context of a myriad of challenges within the region. I think for me, that's really, really very key and a very important point of reflection. Of course, cementing that, and one of the presentations made today was also putting at the center of all this going on is the role that has been played by WHO regionally, both the country offices in the member states, but also the regional office in providing both technical and material support in supporting countries walk the talk. So all these case studies or reflections we had yesterday, we got a lot of reflections and kind of examples of how the local WHO country offices and also the regional offices have supported that. But also importantly, I think a point of note for me today was the presentation by Saj, which kind of has summarized what has already been happening in terms of now harnessing together or using and leveraging on of the already existing capacities within the region and harnessing together a common platform or creating a framework within which we can work collaboratively and coordinated well together to have all resources put within a common framework for supporting data gathering, data cleaning, data analysis, and providing it as useful information to decision makers within the Integrated African Health Observatory. I think Saj went into great detail talking about that. I think also was another point of reflection for me is the emerging and the existence, both the existence and the emerging of a number of regional institutes, or particularly technical partners beyond the ministries, which I was talking about, is a whole range of institutes, of course, ourselves and Institute Pasteur who are invited to co-host this, but also the whole range of partners, especially the WHO collaborating partners. We've heard about several other networks and initiatives, including within the course of the two days, including the COP platform. We've heard of the AFIA platform, the H3Net platform. So several networks focusing on various aspects of data use, data generation, or data translation for decision making. So quite a number of initiatives already happening. But also key among that is also the existence and the centrality of what you would call the regional bodies or regional institutes, it was, so I've already talked about the WHO, Afro, but also African CDC, the African Academy of Science, in playing a very important and central role, a coordinator or a galvanizing center for some of these institutes and initiatives that are happening to support government, their government actions or government priorities within these. And for me, that becomes probably, highlights a very important place of focus in terms of thinking about moving forward, especially with the aim of strengthening the processes for this. So as we move forward, I think with the session that has just concluded, we've been reflecting about what next steps, both in the immediate term, but also in the long term. With this reflection of the needs within Africa, the current status and existence and the emerging priorities, I think a couple of things come into play for me as we think about how we move together forward, both within the region, but also within the network now globally. The need for strengthening partnership and true allyship in this process, really. And what I mean by true allyship is actually really ensuring that the centrality and participation of regional governments, regional government players, particularly Ministry of Health, in this whole process. And because why I say this is because quite a number of times when we have conversations like this or initiatives for so-called capacity strengthening or empowerment and support, sometimes we sit thinking or do assume of government as passive recipient of that capacity. And I think what we've seen or we saw yesterday, the example we saw yesterday, we've seen actually there's been a lot of initiative by local government actors really within the region to take up that. So there's really need in thinking about how we will even harness and strengthen that process of actually empowering government players and also regional political players. I think it has been emphasized in the session that just concluded. I think I can't overemphasize that, the importance of true collaboration and partnership to avoid duplication and to enhance maximization of the limited resources that we do have, but also importantly to provide a platform for peer-to-peer learning. And I could call and emphasize here peer-to-peer learning, and especially a specific call I have to our global partner is, I mean, you would notice, and I'm sure you've noticed both within this today's meeting, but also in your engagement here, that we have highlighted with a whole range of regional institutions and institutes, including partners in government. We are at various levels of capacity, and there's need to actually strengthen that capacity of some of us. But I think that needs to be seen as a kind of a two-way process rather than kind of a one-way traffic of capacity strengthening. Of course, ensuring that allyship and the speaker had highlighted earlier within that. So as I conclude, without taking too much time really, I want to leave us with some reflections or some words which always inspire me when having conversations like this, from Srilata Litwa in her book, Engaging with Empowerment, an Intellectual Experimental Journey, I think which reflect quite a lot of what we're seeing in the region and of course the potential within which this collaborative presents to us. The words are, when we are still looking for the path which we wish to tread, walk in front of us, help us to find the way, and when we grow sure, walk beside us in true partnership and friendship. And when we finally actually find our destination, please find the courage to walk behind us. Of course, we know we will occasionally fall, triple and fall. We will need you to help us find that journey. I think I will end there with my reflections and take this opportunity to hand over to the co-chairs. I think Jenny is online. I can't see Helen. So I will take this opportunity to actually invite Jennifer, one of the co-chairs of the collaborative, to make her closing reflections and then invite Mark to end the session today. Thank you, everyone, and bye from me for now. Thank you.
Thank you so much, Dr. Benjamin. Really appreciated your excellent remarks and a reminder of the role that regional institutions can play in the Health Data Collaborative moving forward. So again, thanks to all of you for participating today and yesterday. I think it's been a great couple of days and really rich discussions. I agree with you, Benjamin, that the last session was had some really interesting discussion points. So I will just take a few moments to reflect on both the 4 strategic shifts that Craig presented on, and then some reflections on the 4 objectives moving forward, and how I think that what priorities are within those elements. So with the strategic shifts, I think it's great that there will be an even greater emphasis on increasing diversity in the representation of individuals and institutions in the Health Data Collaborative. That has been, hats off to the Secretariat for all of their work this year in increasing the membership of HDC, but this is another, it's continued effort. So I think that's an excellent strategic shift. Also fully support the increasing the knowledge brokering or comms advocacy function of the Health Data Collaborative, because it has this potential to serve as a very useful knowledge platform for other initiatives that are doing health information systems strengthening, to disseminate all of the tools that have come out of the working groups, to help increase the uptake of these tools and make sure that that all of these materials are responsive to country needs. The other issue around scaling up, I definitely think that a strategic shift or priority for the next coming years is thinking a little bit more around what it means for a country to be a health data collaborative priority country, and what the HDC is going to really contribute to responding to the priorities that those countries have put forward in their data and digital plans. And so us thinking through more, Craig had mentioned it on the proof of concept. So once we kind of get that a little bit more developed and can even take these first 5 countries and do a little bit more of a work on how the HDC partners can come together and really support those priorities that they've presented to us, that would be great. And then certainly scaling that up to other countries and regions would be great. For the investment case, I think that's a very exciting opportunity. Would need some further discussion on the role of the Health Data Collaborative, whether it's helping to shape the concept, the methods, and reviewing drafts, or what the role is for the Health Data Collaborative in driving that investment case. So building off of those points into the 4 objectives, I think that those have been outlined really nicely in the presentation that Craig gave, and also in the documents that you have available through the Google Drive. I just wanted to again highlight the issue of some of the ways in which, or the mechanisms through which these objectives can be achieved in the coming year. So the first is around, again, I've already mentioned it, the knowledge brokering piece, but really I think the greater investment in that website platform so that it's easy for users to find the materials that they want, and increasing what's on there, again, serving as a really great hub for information around health information system strengthening would be great. And then I really just want to applaud the Secretariat for pulling together some excellent webinars over the course of the year, another means of sharing information and disseminating and increasing the uptake of all of the tools that many partners have put together to support countries. Similarly, I really was pleased and impressed with the outputs from the 7 working groups. It's great that we've got 7 that are up and running and functioning, and think that the Secretariat and the steering committee should really reflect upon the requests that came from the working groups on their sincere interest in pivoting their work to make sure it's responsive to country needs and increasing the participation of countries in those work streams, as well as having some support to strengthen the coordination across the working groups so that they can leverage each other's strengths. Similarly, I just wanted to go back to the whole point on the regional platforms. As you've heard, the case study work that's ongoing on alignment has really depended a lot on engaging with regional partners. And we've heard an excellent rationale for why the regional entities should be an instrumental part of the Health Data Collaborative. So many thanks again to Dr. Benjamin for that. Lastly, I just want to reflect on the other issue of, at the global level, this movement this past year of greater coordination between the Health Data Collaborative and SDG GAP. So that sort of, and then also with the opportunities with the GFF alignment group and UHC 2030, that the more coordinated we are at the global level, then that can help with reducing duplicate efforts in countries and also making sure we're approaching countries with a united effort that is responsive to their needs. So I think with that, those were my main thoughts. I'm not sure if Dr. Helen is on the call now, or if I should hand over to Mark. I can't see. Actually, I do see Dr. Helen on the screen. Helen, would you like to make some closing remarks? Helen is another co-chair of the HDC, who is a monitoring and evaluation expert in the Ministry of Health in Kenya. Over to you, Helen.
Okay, thank you, Jennifer. And apologies, I dropped out. And, yeah, so I don't want to give many more additions. I think Jennifer has covered most of the issues. But I think my remarks is really just to allow the HDC for really prioritizing, coming up with efforts to prioritize country data and digital goods, and just urge everyone to really rally our efforts around supporting country priorities, so that there's alignment and reduction of duplications, so that our efforts, especially by partners, both financial and technical, are well aligned, and they go further along if we're able to align this kind of efforts, and really just taking note of the progress that the HDC has achieved, and with the latest with the cooperation or the coming on board of the two institutes to build capacities for countries to synthesize quality data to inform our progress. So other than that, I really want to thank everyone for your time and effort over the last 2 days, and hoping that we will continue working together to support our countries. Thank you very much.
Thanks, Helen, and thanks, Jennifer. I'm back very quickly. I can see that my brother and colleague, Dr. Amadou Sall from Institute Pasteur, has finally managed to join us. So maybe take this opportunity to request him to make a few reflections, closing remarks, before we invite Mark to finally close the session. Amadou, over to you.
Yeah, thank you very much, Benjamin. And first of all, my deep apologies for all these technical problems. Just wanted to say first, want to congratulate all the initiator of this initiative, and that we are extremely proud and privileged to join this initiative, which is for us critically important, as probably Sheikh and the team has laid out. This is part of our core strategy, and being like supporting the other countries and as an institution in what we're doing in terms of data, in terms of health and collaborating is absolutely critical. I just wanted to give a few remarks about what can a regional role be for some of the institutions like IPT. I think one of the first point that we should have actually in mind is one of the critical area where actually we have some challenge most of the time is really when it comes to align the technical and financial resource around a common goal, and where we're looking for both measurement and accountability. Because obviously all we're doing has at the end of the day lead to some impact, and how we make sure that we can document this impact and making sure together we can work and being aligned seems to me very critical. And in that position, actually the regional institution can play a very important role, at least from the experience I draw from other field of expertise where we're playing this role. We can assist countries and can make sure that down the line we have some impact that can be measured and for which we can be accountable. The second area where really it's important is trying to make sure we can synchronize different efforts, because what we want to be doing at the end of the day is really synergizing efforts and making sure while they're working together, we have addition which is going to be at the end much higher in terms of impact than the sum of these individual aspects. And for that, we need to have some sort of synchronizations around this term goal and actually to make sure we can reach that objective. Now, the last thing I think where also we can have a regional role can really play, a regional institution can play a very important role. It's really about sharing experience, common practices, and best practices. We've learned over other different centers we're doing, and for which we have a sort of regional role, that what we can say in different countries is a huge resource and a lot of great resource that we can use actually to leverage on and make sure that this is what the other different groups are also bringing together. So on these 3 points, I just want to convey the message that as IPD and as a partner of this initiative, we'll be really focusing and making sure that we can bring any contribution that is relevant to us. And with the whole team, we wanted to thank you for bringing us into this and also making this very great initiative to be relevant and important for Africa. Thank you very much.
Thanks, Amadou, for those very wonderful reflections. And finally, colleagues, as we come to the end of this today meeting, it gives me great pleasure to welcome on stage Mark Howard. Mark is Associate Director of Data Analytics from UNICEF to make the closing remarks and close this today meeting for us. Thank you. Welcome. Over to you, Mark.
Thank you so much, and it's really great to be able to join you in this wrapping up period of an excellent meeting over the last 2 days. This meeting really, I feel, represents a major milestone in engaging regional institutions in the achievement of HDC's objectives of strengthening country health information systems and improving partner alignment around the priorities identified in the HDC pioneer countries. And of course, I really want to thank our hosts, the Kemri Wellcome Trust in Kenya and the Institut Pasteur de Dakar in Senegal. And, you know, it's awfully frustrating not to be able to be together in person in Africa because of the pandemic, but we're really grateful for these 2 institutions being willing to host our meeting and to describe what they're doing and bring us together to describe what we can do to support country data efforts in the region. You know, the experiences this last year in trying to increase HDC support to countries showed just how important regional institutions are in the effort to increase country capacity to collect, analyze, and use data, and to strengthen country data collection platforms. The case studies that are underway, which we learned about yesterday and today, have been greatly facilitated by regional colleagues in Africa, in Asia, and in Latin America. And these case studies will also partner coordination and financial and technical support to countries, and to align partner activities with the country's own agenda, which is really crucial. The main theme threaded through this 2-day meeting really was keeping countries at the center of the HDC initiative. And the updates from the 7 working groups on day 1 showcased all their achievements this year, including the development of new global public goods like the Community Health Information System module and other products. The working group discussion session ended with a strong consensus on the way forward for 2022, a concerted effort to improve how the working groups support the HDC pioneer country priorities and how they can best coordinate and leverage their activities for the greatest impact. We heard today more reasons why we should work together and coordinate investments in country health information systems as being central to the country's ability to achieve the 2030 agenda. And today we also heard about the progress HDC has made in the year to coordinate with other global initiatives that have similar objectives on health information system strengthening. Always a challenge in the health field is so many different initiatives which we really need to be working together if we're going to have the major impact. So HDC's formed a strong partnership with the SDG GAP Data and Digital Accelerator and works closely with UHC 2030. And we have plans for collaboration with the new GFF Aid Alignment Working Group as well. This partnership approach at the global level is something that we should continue to and strengthen in 2022. And also looking to 2022, we need to be making sure that we continue this knowledge brokerage function of the HDC, serving as a platform for disseminating good practices around health information system strengthening and on tools for countries to use. And we've really got to keep working on that in 2022. At UNICEF, we're committed to working with countries, starting at the community level, to help build strong, resilient health information systems so that the countries can make evidence-based decisions on financial and programmatic priorities. The COVID-19 pandemic has made it clear how important high-quality data are for enabling countries to respond rapidly to crises whilst maintaining essential health services. The pandemic has also raised critical questions around data governance, another topic of increasing importance to UNICEF and other agencies. How do we collect data? How do we ensure they're collected ethically, used responsibly, shared in a way that safeguards human rights at the same time that we're trying to support them? These are all important governance efforts that we have to work together to ensure can be upheld. So the aims of the HDC, in view of the pandemic and climate change realities, are even more important as we head into 2022. We are looking forward to working with all of the partners in the HDC to advance data governance collectively and to support country-owned health system strengthening efforts, always focusing on the country level, which is where the biggest difference will happen. Thank you again to our hosts and to all of you for joining us in these 2 days of meetings and for everybody's commitment to the HDC.